Hello? Um, Can everybody hear me?
I can hear you.
Okay. Is it thumbs up now?
Yes. Yeah.
I actually can't hear myself in the room.
Joanne, we can hear you.
I mean, can you hear me online?
Yes.
So here's something
Yes.
from a technical
Yes.
perspective. I know that the CGHD IT team did a sound check, but we're just going to quickly do it in the room because we've been having some sound issues this morning. So before we all get started, welcome everyone, but we're going to just handle some IT kind of issues. So if you don't mind, Gerhard, I'm going to start with you. If you can quickly say hello.
Yes. Hello. Can you hear me? Yes. I could hear Leslie Ann and the others, but I can hear you, Joanne, but it seems you cannot hear me.
Oh, I can hear you now.
Okay, perfect.
Okay, that's great. Jessica?
Yes, I can hear you well. Hi, everybody.
Hi. Leslie?
Hello, I can hear everyone clearly too. Thank you.
Okay. Oh, now I can hear myself in the room. Great. Ikuyu?
Hello, good evening from Japan. Can you hear me?
Thank you. Serbi?
Hi.
Okay, great.
Hi,
That's
everyone.
wonderful.
Hello from
It
South
makes me feel
Africa.
so happy that we can actually hear each other, which is kind of basic, but okay. And the rest of our speakers, John. Hello. Okay. Well, based on that, I think we're good to go. So I want to thank everyone for coming, and on behalf of both CGHD, CRDF, and USNCI. We're really excited to look at this topic in terms of, sustainable financing models for a women's health. And we're discussing a lot of topics under this, from areas of nuclear science and technology. We're going to hear from speakers in terms of the case studies. We're going to look at how HIV/AIDS, and we have some investors on the phone. We also have a lot of women philanthropists and investors who are attendees. And I want to thank you for joining us now. This is our third World Bank IMF session. So thank you for being there. And we are depending on you to fund and help us catalyze a lot of the initiatives that we're going to be talking about. So with that, I know that you are in different time zones, including Japan and Australia. So I really don't want to waste any additional time and get started. And as you speak, if you could introduce yourselves. And so I'll turn it over to Colin Buckley, who is Managing Director and General Counsel at British Invest International. And Colin, we've worked with you for many years, and I'm always awed by how British Invest International is deploying a lot of funding for impact programs and really transforming how we look at the field of not only development, but specifically areas, tangentially related to health. So Colin, over to you.
Thanks very much. And it's great to be here. I thought what I would just do today is share kind of our story about how we got into gender lens investing. Does this work? I think that's on. Does that work? All right. So our story on gender lens investing and how we got into gender lens investing and what our experience about that has been. So we launched our gender strategy in 2018. But I think a large part of it was around the 2X challenge. And I'm not going to really talk about 2X that much because I think we have Jessica, right, on the panel. I will leave it to Jessica to tell the story about 2X. But 2X for us was really formative. I mean, we were one of the first DFIs that were part of that initiative. And internally, that prompted a lot of work to kind of understand gender lens investing. That's kind of what pushed us into the whole business. So let me skip to where we are now. I mean, the latest iteration of our approach to gender lens investing was when we refreshed our strategy 2 years ago, and that involved a new strategy around development impact. But from a gender point of view, we took two steps. One was we wanted to make sure that we thought about gender in every investment that we made. And so we have a rubric by which we score potential investments for their development impact. And this is not an enormous undertaking, like, for example, the IFC's AIM. This is pretty stripped down. We look at really only 9 things, but one of those things is gender. And so a big driver of the score that any potential investment would make is the gender lens. But we knew that that wasn't probably enough, that we also needed to make a commitment on the portfolio as a whole. So we also stood back and we said that we committed that we would have 25% of our investments each year to be qualified as 2X investments. We thought that was a pretty ambitious target, and Jessica will tell the story, but a large part of the story of 2X is every time we make a pretty ambitious target, we end up doing a lot more than that pretty ambitious target. And that is true about this 25% target. I mean, we said it, I think, 3 years ago. In last year, over half of our commitments were 2X qualified. So that's almost $1 billion of investing that we did that was 2X qualified. So how do you get there? How do you get from here to almost $1 billion of gender lens investing? Mm-hmm. And for that, we've started to think about gender, not in the selection of investments, but in the origination of investments. And I think that's the big message that we've learned, is that you have to educate the investment teams about what gender lens investing looks like, so that when they're out in the market, they're proactively, if you will, leaning into a family of potential investing. So the biggest ways that we have found gender qualifying investments, one is gender-directed lending facilities. And then the other one is a new kind of innovative approach that we've been taking, which is to marry commercial incentives to gender outcomes. And I'll give you 2 examples of that. One of them is in lending, where we're lending money to a business. And if the business hits certain gender targets, then the interest they pay ratchets down. So they have a commercial incentive to sort of hit these targets. The other place where we've done this is with funds. Now, there are a lot of gender funds, and there the mandate for gender investing is pretty clear. But with non-gender only funds, we have offered a commercial incentive so that the carried interest of the fund ratchets up as they hit more and more ambitious gender targets. And so those are some of the tools that we're using, nowadays to drive gender investing. I mean, another theme that I'm sure we're going to talk about today is technology. Mm-hmm. All right, and you would think that to talk about gender investing in technology would be like 2 distant corners of an investment universe, but in fact there's a lot of overlap. And the reason is that in Africa, which is where we principally invest, the lack of access to capital, the lack of limited market linkages, the problems with cultural norms are all challenges that you can actually overcome with digital solutions. And so increasingly technology plays a part in our gender investing. And I thought I would just, tell the next part of the story by offering 3 examples of investments that we make, which are all radically different, but kind of inform how wide this universe of gender lens investing can be. So the first one is Trade Depot. And Trade Depot is a Nigerian online marketplace that basically lets you buy stuff to sell stuff. All right. And I mean, we've all been to Nigeria. You see Trade Depot customers all the time. They're all those tiny little kind of fans and sellers on the streets everywhere in Nigeria. They are predominantly women, and they struggle to purchase the products that they sell at non-retail prices. They can't get them at wholesale. They also struggle many times. They get up in the morning, they go and they try and buy the amounts that they want for that day. And they struggle sometimes, they can't find it. It's all sold out. So there's no consistency of their product. There are a lot of pricing constraints. And so Trade Depot is call it technology is perhaps to kind of gild the lily here. I mean, what it is an online marketplace where they can buy the stuff they need to sell at the prices they need in order to sell it. But something as simple as that can have a huge effect on women in Nigeria, because 85% of the customers of this platform are women. And we knew that going in. What we didn't know was that 65% of the sellers were women, because a lot of the businesses that were willing to sell to these very small businesses were themselves SMEs. I mean, they're not sole proprietors, if you will, but they're relatively small businesses. They had, a much more streamed down model. 65% were run by women. What does this mean for women selling on the streets of Lagos? Well, on average, their sales go up by 150%. On average, their profit margins go up by 40%. So simple idea, huge effect on women. Another way that you can have impact on women is by investing in a business that has a profound impact on women or on women in women's health. I'm going to give 2 examples of this. One was our first direct equity investment in India in 2013, which was Rainbow Hospitals. Now, why do I want to talk about Rainbow Hospitals? I want to talk about Rainbow Hospitals because there is still a sense that if you are doing gender lens investing, you are leaving money on the table, that you're not getting the same returns. I don't believe that's true. I believe you can still get, with prudent investing, outsized returns and have a gender impact. And I think gender investing is one of, I'll be honest, the few parts of the impact investing universe where that exists, where there is no trade-off. So we invest in Rainbow. When we first invested in it, they were in one city, they had 5 hospitals. When we exited in 2022, they were all over India. They had 16 hospitals. They went from 300 beds to 1,500 beds, blah, blah, blah. For us, the numbers I want to leave are the following. The first one is we made 26% IRR on our investment, which for a development finance institution, that is a big fish. The other one is that, we built or helped build a system that treats more than 1 million mothers a year in a country that still struggles with very high infant and mortality rates. Rainbow also has, almost 4,000 employees. It's a maternity care hospital, so it's not surprising that more than 50% of them are women. the next investment I want to talk, which is even more on the technology front, is Niramai, and I was speaking with Susan about this because Niramai is a women-founded, women-led, non-invasive breast cancer screening facility in India, and I mean, Susan will speak about, will speak about this a lot more than I will, but there are a lot of cultural aspects to trying to promote breast screening in India. And it is, I would say, almost a necessity that if you are going to make inroads in cultural changes, you have to have a woman-led or business doing that. And certainly that's true about Niramai. I mean, they now run, I think, over 700,000 screenings a year, and we invested in that as kind of a startup. So that number is pretty significant. I'll kind of conclude at this, at that point. How do we do this? How do you get all these good stories? I mean, you build a team. I mean, that's it. We have a team. I mean, it's not a huge team. I mean, we employ 600 people, and our gender team, I think, is probably, 4 or 5 people. But you need a team. You need to have people who wake up in the morning and this is their job, to just think about gender investing. You're not going to get there if you basically take an investing team that's doing a whole bunch of other stuff and you just layer on, please think about gender investing as well. It also takes time. And change doesn't happen overnight. Change doesn't happen inside institutions. I think investment institutions are notoriously slow to change. But with perseverance and with commitment from the top, gender lens investing has become a key part of what we do, and I think is a key driver of the impact that we have today to increase women's representation and inclusion, not only in the C-suites of businesses, but also in the impact that those businesses can have. So thank you.
No, thank you, Colin. As always, I think, as the audience gets a flavor for it, these investments have been transformative. I think what we're looking here also is, within this group and looking at those case studies that we can scale in different ways, both financially and also in terms of sometimes, as you said, you use the word gender facility. So a gender facility, for those that are not familiar with some of the financial language, it's really a technical assistance facility in a way. And as we're thinking about funds, and I know some of you online are also thinking about creating these big funds for technology for women's healthcare. Those technical assistance facilities are transformative in some of these investments, and we hope to make some of the investments here with this group. As the investment you mentioned on Rainbow with 26% IRR. I mean, I think that's amazing. And so I'd like to focus this a little bit more on the vision of 2X, because I think a lot of that gender capital, in the room and with the investors can be used in deploying some of what we need for that end-to-end, solutions for women's health. And Jessica, I mean, I think when the G7 announced, the billions of dollars of gender money, and that's out there. And what is the vision of 2X, if you could tell us at a high level, as we're looking at these case studies and as our women investors, philanthropists are looking at these bigger kind of overviews. One big thing that I'd like to remind all of you, and some of the investors, remind me, is that PEPFAR was one of the original kind of infrastructures in the African continent that allowed investors to go in. And many investors tell us we would not be in the African continent were it not for PEPFAR. So as we're reimagining, these investments into women's health in the areas of nuclear science and technology, how do we think about this differently so that we almost, use those backbones to grow and scale what we already have on the continent? So Jessica, over to you.
Thank you so much. It's a real pleasure to be there, and thank you for facilitating the hybrid format. It's great to be joining you today. I have prepared a few slides. Can we try if it's technically possible to show them?
It may not be, sorry.
Okay, no worries. No worries. If not, don't worry. I can circulate them afterwards and just
Okay,
speak to them.
that'd be great.
Great. So I think it's worth taking a moment to reflect a bit on the journey of the 2X Challenge, and we've already heard from Colin how pivotal it was to get the different DFIs around the world on the journey of genderless investing, and led to a number of different actions, like really to look at the entire investment process and embed a gender lens. So our journey started, as I'm sure many of you know, at the G7 summit in 2018, and was initially this unprecedented commitment by the development finance institutions to collectively invest and mobilize at least $3 billion over 3 years. And at the time, there wasn't really a very clear definition yet of what we mean by gender finance or gender lens investing. And this goal seemed incredibly ambitious. Everybody thought this was, wow, 3 billion in 3 years. It's an ambitious target. So what we did first was to launch a community of practice and a working group where we brought together the environmental and social and impact specialists from the DFIs, but also the investment teams who are working day to day with clients and investees. And we looked at both the impact case and the business case to make this really sustainable, and identified interesting opportunities along the entire business value chain. So starting with entrepreneurship, of course, looking at businesses founded and run by women and owned by women. Then leadership, looking at the opportunity of gender diversity in leadership and top management on the board of directors. Then we also looked at the employment space and the incredible economic case that we see in closing the gender gap, for example, in the labor force, which we know would boost global GDP by 28 trillion per year, according to McKinsey. And then importantly, we also looked at products and services design. And that is, I think, especially important, and where we've seen a strong case for both business and impact in the women's health space, where solutions have been particularly underfunded or been gender blind in the past. And so equipped with kind of that evidence base, that early evidence base of the business case and the impact case of gender finance, we collectively developed the 2X criteria as a shared framework and a set of shared definitions and metrics of what we mean by gender finance. The 2X criteria focus exactly on these areas that I just mentioned. So entrepreneurship, leadership, employment, and products and services. And the fifth criterion looks at when we invest in financial intermediaries like financial institutions and funds, how do we look at those criteria both at the level of the institution itself and at the portfolio level? We spent the early days really focusing on harmonization. So we collaborated with the Global Impact Investing Network and the IRIS Plus standard and integrated our underlying metrics into that existing standard, so that basically overnight all the investors worldwide that were already using the IRIS Plus standard could easily also adopt the 2X criteria and these metrics. We then also spent significant time, as Colin pointed out, in really working with the set of DFI participants on looking at the investment cycle, at our internal practices and capacity, on how we can become more gender smart in origination and looking at opportunities in the market, but also importantly on value creation. So as we work with our investee companies or financial intermediaries, how can we be much more intentional about how we embed gender as a value driver and as a lens in everything that we do together. Fast forward, as I'm sure many of you know, we were able to significantly surpass our original target. And we ended the COVID year 2020 with 11.4 billion invested and mobilized. So it was significantly more than the original 3 billion target. And what was particularly interesting was that the COVID year of 2020 was incredibly successful. That was when we had kind of seen the learning curve and really were able to have a strong pipeline and make significant gender smart investments, which was interesting because it was also a year when there was generally this perception that it might be much harder to make impactful investments and that the pipeline might dry up. When we look at the different investments and case studies, and you can find a range of publications on our website, we really see a wide spectrum of gender smart investments. And Colin has mentioned some really great and impactful ones in the health space. We also had many at the intersection of gender and climate, which was really interesting to see how we can leverage this nexus and make climate finance more impactful by having a gender lens, and how we can make gender lens investments more climate smart. We also saw interesting examples, for instance, of gender bonds. So the first private sector women entrepreneurs bond in Asia Pacific that was issued under the 2X challenge. We had interesting fintech investments that looked at tech and how to make tech products more gender smart and incorporating kind of the women's perspective. And also direct investments, for example, in agri-businesses that took a gender lens across the value chain to make their entire model more inclusive and gender smart. We, from there, saw a lot of interest from the broad spectrum of capital providers globally who had adopted the 2X criteria, who were interested in joining us, either co-investing or being part of our thematic communities of practice. And so building on the success of the 2X challenge, we launched what was then the 2X collaborative that brought together institutional members from across the spectrum of capital providers. And we set up and scaled various communities of practice, focusing on thematic areas. And one particularly prominent one is our gender and climate finance community of practice, where we collaborated, for example, to develop a very practical toolkit across a range of different sectors to show what the opportunity looks like in practice and how we can make climate finance more gender smart. And that toolkit was launched at COP26 in Glasgow. And since then, we're now at every COP sharing updates and case studies on how this toolkit has enabled catalytic investments. And we're currently exploring how we can work with the range of capital providers and members on creating similar toolkits in other priority areas. And one particularly interesting one is women's health, where we currently see a lot of interest from among our members to do more. As you may
Jessica,
also
I don't mean
be
to
aware-
interrupt you there, but I think with the toolkit, you have a willing membership here from the Women's Health and Empowerment Network to work with you on that women's health
Amazing.
toolkit as those metrics for financing are deployed.
That would be really great. And perhaps to kind of fast forward on, what's the vision, what's coming next. As you may all have seen, we recently merged with Gender Smart, who was also alongside 2X, a leading field builder, and are now 2X Global, so operating as one integrated organization. We have over 100 member institutions globally across the spectrum of capital, so from philanthropy, the DFIs, private equity, financial institutions, and other types of capital providers. And in addition to building more toolkits and really advancing the field of gender finance, we're also keen to launch the next 2X challenge, where we want to now crowd in the full spectrum of capital providers. So building on the success of the previous 2X challenge led by the DFIs, and where other private investors were co-investors, we now want to open up participation to the full spectrum of capital providers. And where we see particularly interesting opportunities is to have kind of like sub-challenges. So where we have our communities of practice interested in specific themes, who take a specific focus under the 2X challenge to shift more capital to where it's most needed. And one of the priority areas is, of course, gender and climate, where there's a lot of interest. But what we're seeing at the moment is that almost more popular than climate at the moment is health. And we have a significant number of investors globally who are keen to have, under the 2X challenge, a focus on women's health, and would love to collaborate with all of you to see how we can really build capacity of those who join the next 2X challenge and collaborate on impactful investments.
And Jessica will take that partnership under the Women's Health and Empowerment Network. I think it's important as we're seeing a lot of investors deploying capital. I know some of you are on the phone, Gerhard from Sirona Asset Management, who's helped me create some of those funds on girls' education, $250 million fund. Before I turn that over, I just want to have our colleague from Japan, Deputy Director General for the Japan International Cooperation Agency, Ikuyo, have known for many years, speak briefly because the G7 is hosting the presidency this year. And so I think in terms of G7, announceables or things that we're thinking about, I don't know if there's any, I know you're going to talk to kind of the gender smart lens or any innovative financing thinking around global health. Over to you, Ikuyo.
Thank you very much. I hope you can hear me clearly. And thank you very much for CGHD colleagues, particularly for Joanne, for inviting JICA to participate in this very exciting panel. As introduced, I'm currently serving as the Senior Deputy Director General of Human Development Department, which is in charge of our health programs globally. So I'm basically a public health person and not the investment person. So I'm not sure whether my talk today is really relevant to the participants, other participants, but I try to be as relevant as possible. When it comes to women's economic empowerment and health, we are approaching from the two dimensions. One is the mitigation of downside risk, and another is provision of opportunities for income through businesses. And as for mitigation of downside risk, I want to stress that one of the major risks in low and middle income countries is still poor health and the expenditure associated with accessing healthcare. So according to UHC monitoring report by WHO and World Bank, the incidence of catastrophic health expenditure was increasing globally even before the pandemic. So I believe the situation is becoming worse. So definitely there should be a good way to mitigate the financial impact. And Japan is, as you may know, Japan is firmly committed to the achievement of universal health coverage and resilient, equitable, and sustainable universal health coverage. And will be also highlighted in the G7 communique this time. And JICA is supporting the countries in Africa and Asia in their effort to achieve universal health coverage, combining technical cooperation as well as financial assistance. And we are increasingly using our concessional loan in the form of general budget support, or what we call a development policy loan, to engage national treasuries and the recipient countryside, so that the funding is really kind of sustainable. And in the case of, for example, in Senegal, we provided a concessional loan together with the support from other partners and effort to support the effort of the Senegalese government. And it was really successful, increasing enrollment of poor households in mutual program. It is basically the health insurance program, from less than around 200,000 households to more than 1.4 million households, and many of them, the beneficiaries were actually women. So, the mitigating the downside risk of related to poor health is a very important aspect of women's economic empowerment. And also, it is helped to increase the proportion of health posts staffed with pair of nurse and midwife from 40% to 90%. Creating employment opportunities in public sector. So our support to health institutions is also contributing to the employment opportunity of women, many women. And I can also share with you about our support in creating opportunity for income gain through business, though it is not my area of specialty. Those activities are managed by our private sector engagement groups, but we also support the economic opportunity, to providing economic opportunities for women. And one area of support is through various platforms and programs for business incubation and acceleration. And one example is our program called Ninja, or New Innovation with Japan, program which was created in 2020, targeting many countries in Africa and Asia. And another example is what we call a Homegrown Solution Accelerator Program, which is a joint program with AU NIPAT, created in 2021. And since both of them were created at the time of the pandemic, the initial focus was really businesses which can contribute to COVID-19 response. And many of them are women-led and contributing to employment of women and benefiting women as well. And of course, another area of support is the provision of credit to the businesses which contribute to gender equity. We are also the very active part of the 2X challenge, as mentioned by Jessica. So I do not have to go into detail, but we are supporting the investment as a DFIs of a G7. We are investing on the gender equity fund, like Women's World Banking Capital Partners 2 Fund, or COVID-19 Emerging Frontier Markets MSME Support Fund, or the lending to commercial banks like Vietnam Prosperity Joint Stock Commercial Bank. So we are causing our investment through those financing institute or the various funds to benefit many women globally. And coming back to the G7 discourse for this year, because Japan is hosting the G7 in Hiroshima this year. Actually, the summit will be held next month. I want to flag your attention that the possibility of establishing new initiative to promote impact investment for global health is being discussed as part of the G7 process now. So let us keep an eye on what will come out as joint G7 initiative from Hiroshima next month. We are hoping to have something to promote. We talked about, or the previous speakers talked about the gender lens, but maybe we can add a global health lens to the investment this time. We're hoping that. And I'm expecting to see more. So in conclusion, I'm expecting to see more opportunity to collaborate with you to promote economic empowerment as well as health of women globally through different channels and platforms and initiatives. So that is my brief intervention. Thank you very much. And thank you very much for giving me the early time so that before my brain stops working or malfunctioning, which is even worse.
No, thank you very much, because I know it's so late, and I think we look forward, to working with you, the Women's Health and Empowerment, which includes private sector companies, women investors, philanthropists, governments, to really, in the next few weeks, I know you're going to have a lot of conversations, and there's a lot of mechanisms that have already been launched, and there's a lot of lessons learned, and also challenges in how governments design these blended financing instruments. And I think, to get concrete, because as many of you know me, when we do these things, I hate just talking. We need to just do. And the thing that I find with CGHD and with some of you in this room is that when we talked about girls' education for Africa, it was an education. And 6 months later, we deployed a $250 million fund. And so I think with the case studies that we're all focused on here, whether it be an end-to-end women's healthcare case studies or financing case studies of how we look at technology for women's healthcare in the areas of nuclear science and technology, I think we can find the funding mechanisms necessary. You all have capital, both philanthropic or investment. So let's look at these case studies and use a roadmap. Before we convene this session, as I was talking to some of you, you told me, look, we have capital. We have both philanthropic and private equity capital. We really need a roadmap of how we all come together and invest, our technical expertise, and priority countries so that we don't waste our resources investing unilaterally. So let's also focus on that as we're looking at that. With this, I'd like to turn it over to Gerhard, and I'm going to challenge you. Can we create a fund for technology for women's healthcare, looking at diagnostics, lab equipment, nuclear science, supply chain management, renewable energy. Is this possible? I know you helped to create a blended financing fund that CGHG worked on with the Canadian government, and then the USAID fund for girls' education, and then the other fund for women's health that was only 20 million, but 20 million in the global health world is a lot. So over to you, Gerhard. Can you get us practical? Can we do this? Can we use some of these case studies? Maybe, as Colin said, build a technical assistance facility next to it, or maybe like a gender facility.
Yeah, thank you, Joanne. Appreciate joining you. I wish I was with you at the spring meetings there. I haven't been there since COVID, so would love to have joined you in person. Thank you also to the valuable comments and contributions by Colin and Jessica and Akuyo. That was Akuyo. I'm going to be listening for what announcements you referenced there. Some support for women's health investment. That would be wonderful. Just as a brief introduction, related, or a background about myself related to the topic at hand today. I am, on the one hand, a founder and now chairman, until recently the CEO of Srona Asset Management, which is a private sector investment firm, an impact investment firm investing in emerging markets. And on the other hand, I'm also the chair of the investment committee for Grand Challenges Canada, which is a health and innovation platform. And these are important to me because it spans the spectrum of public sector investment and private sector investment. In the public sector side, the Grand Challenges Canada investing in high risk, early stage innovations, the kind of things that the private sector doesn't want to invest in. It's too risky, but private capital just doesn't want to go there. And indeed, we did a review. Oh, this must be 5 to 8 years ago now, of private capital going into health investments in Africa. And despite the fact that Africa has 15-16% of the world's population, only 0.1% of private capital going to healthcare goes to Africa. It's just the private capital doesn't want to go where it's too risky. So on the one hand, I work with public sector funding to channel capital into investments into health innovations, global health innovations through Grand Challenges Canada platform. On the other hand, with Srona Asset Management, private investors, which, Colin, I appreciate you saying that you can get equal or outsized returns through gender focused investments. I believe that, but when you narrow your investment scope, the remit of what you're investing in, invariably investors begin to get a little bit antsy. As soon as you make it more niche, the more niche it is, the more risky it is, the less private capital wants to go there alone. And so within that spectrum of private capital on the one hand and public interest on the other hand, we need a really good conversation of trust to happen. I used to, earlier in my career, I was dedicated only to private sector capital. I did not want to talk to the public sector because I was just burdensome and slow and bureaucratic. But I've come to learn that we need a really robust conversation between public and private if we're ever going to solve or address or meaningfully address the
You mean when I kicked
the
you,
SDG challenges.
when I kicked you, when we were, you spoke at the UN and you didn't want to on public sector capital?
Right. But I got to say, Joanne, I've changed and I've learned and changed over the years, and I do know, and in fact now we have launched a number of blended finance vehicles, as you also referenced, Joanne, where public sector capital incentivizes private capital to go there where it otherwise would not go. And so we've done a number of those. On the one hand, we with Srona has a contract with the Australian government to manage its EMIF program, Emerging Market Impact Investment Funds program. And on the other hand, there's private capital. And in between, there is a way for public sector and private to come together, but the private capital needs some incentive, some motivation to go there where it is afraid to go. And that's where blended finance comes in. It's at the beginning, it's conversations, Joanne, and there's platforms for conversations to happen between public and private. But when it gets to make it real, we need something to draw the private capital in over that hurdle of fear, that hurdle of risk. And that's where I believe blended capital, I don't want to say it's a no-brainer, but it is where the type of capital or the type of relationship where the government or public sector capital can de-risk. You mentioned something about mitigating the downside risk, helping to mitigate the downside risk so that private capital, and there's so much private capital available and interested but afraid. And so to bring that together, in this specific case, not just gender lens investing, but to the specific subject of today, to funds that will invest in women's health and the various elements that contribute to women's health in emerging markets.
And we're going to come back to you, Gerhard, because we're not leaving that thought. I think we looked at it on the surface, but I think as we're getting concrete, I know we need the de-risking capital, and as we have our women philanthropists on the phone, as we have governments here, maybe we can think about who can pool some of that de-risking capital. But I'd like to turn it over to our colleagues from PEPFAR. Michael, you know, a lot of our investors, as I said at the beginning, credit PEPFAR. If PEPFAR had not existed, many of the investors would not be in the African continent. So hearing some of the discussion today, you know, I wanted to get your thoughts on, you know, I know PEPFAR does investments into, you know, women entrepreneurs, into, you know, a lot of HIV/AIDS interventions. How do we address the conversation at hand and help us to move forward to the next steps? And what are some of the visions that PEPFAR is thinking about around sustainable financing?
Thanks. Appreciate the opportunity to be here. So my name is Michael Ruffner, and I'm Deputy Coordinator in the Office of Global AIDS Coordinator with the Financial and Programmatic Sustainability Portfolio. So the PEPFAR program is celebrating its 20th anniversary this year. And without the benefit of a vaccine or a cure, we've managed to bring HIV to epidemic control or near epidemic control in most of the countries that we operate in. However, our mandate is not to end AIDS, but it's to end AIDS as a public health threat. And we committed ourselves to doing that by 2030. And we are not quite where we want to be, but we're still relatively on track to do that. I say that because the response has been heavily donor dependent. We've created parallel systems. We've done things ourselves. We had to do these in an emergency way so that we get the epidemic under control. But the future is going to have to deal with less donor funding to do that. And we are operating in countries that simply don't have the public fiscal space, despite the importance of public finance, does not have the fiscal space to take on the full response in the future. And so they're necessarily, we're going to have to use private sector solutions with private capital to do that. So the good news is that there's an entire program of opportunities out there for different private sector solutions. On the downside, though, we have a lot of structural barriers for government bureaucracy, filled with public health professionals and doctors, and so we don't think as creatively as we should. So we understand that there's a role for the private sector. We understand that there's a role for private finance, but we don't always have the ingenuity and innovation to figure out where those are. On the other hand, particularly when we're talking about women, the demographics, particularly in generalized epidemics, skew heavily women. And a lot of the health sector are populated by women. So there are extra opportunities here, particularly with gender-based funds, that can really unleash their innovations, their technology. And we don't, again, always know where those are and what they could be. They could be everything from service provision to the systems needs, to even some things that we today think are public goods. And so, as I say, we have these structural barriers, but we also have the knowledge that we won't be able to do it alone. And we are thinking about different ways. Our ambassador, John Nkengasong, is pushing us to think and take risks. Again, not something that government bureaucracies do well, and we're going to have to create parameters around how we take those risks. But we have been looking at blended finance models, finding ways to use the PEPFAR platform and the types of investments that we made that will de-risk investments. We're trying to find partners and other parts of the U.S. government that can come along with us to bring some of the startup financing. We can always provide technical assistance. So there are lots of different ways that we can be helpful, but again, we're really looking to the outside to help us think through where those opportunities are and where sort of the biggest bang for the buck is. Again, a lot of our attention is going to be focused around achieving the public financing that is going to be core to this. This is within an envelope that nobody feels is ever enough. And so we have to be realistic about what we can do. But again, this has to be core to our work. I look to all of you to help us think through how we can take these things forward.
Well, Michael, maybe what we can do is also convene part of that WEN working group to, as you're looking at those blend financing. I think that the TA component is so important, and you heard some of the investors, and Colin, you have an example of a gender facility. Those gender facilities or technical assistance cards that come next to these private equity vehicles could be a way maybe to potentially match some of that TA funding while still using, the infrastructure of PEPFAR that, we think is so necessary. And so with that, I'd like to turn it over to Dr. Ted Trimble from the US NCI. One of the things before I turn it over to Ted is that you talk about capital and the US government. We co-hosted a panel with Harvard US NCI during the World Bank IMF meetings, and I sat next to someone who started his comments by saying, I have $500 million that we got from barter to do investments into anything related to pandemic. And I was like, $500 million non-repayable capital. That's amazing what we could do with that. So I think with cross collaboration across, different agencies, private sector investors, philanthropists, we can really make something happen, in this area of women's health that can look at HIV/AIDS and technology. So let's put all our collective networks together and see how we can do it. Over to you, Dr. George.
Thank you very much, Joanne. What we'd like to do next is present some case studies of what is happening on the ground and some potential solutions. I'm coming at it from a focus of OBGYN and GYN oncologist trying to think about how do we tackle cervical cancer globally in terms of prevention and screening and treatment. And so I'd like to introduce one of my colleagues, Dr. Surbhi Grover, who's a radiation oncologist at the University of Pennsylvania. She's been based in Botswana for a number of years as part of the University of Pennsylvania, University of Botswana partnership. And she's thought a lot about both how to deliver good cancer care in Botswana, as well as how to improve both medical imaging and radiation oncology across Africa. So, Surbhi, please go ahead.
Thanks so much, Joanne and Ted, for this opportunity and to be able to remote in from Southern Africa. So I wanted to just start off, as we're hearing a lot about this gender lens investing and strategy, I wanted to just start off with just laying the stage here in terms of health in Africa. So the largest burden of women's cancers, which is cervix and breast cancer, is in Africa. Over 50% of all cases around the world actually exist here. And over 80% of the mortality happens here in Africa. And these women that are dying of cervical cancer are young women in their early 40s. So there's a huge, huge opportunity cost to the society for these women not being able to, do all the jobs that they're doing. And majority of these women, are HIV positive. And while HIV is now really well taken care of, thanks to PEPFAR and several other stakeholders, it's sort of a chronic disease. More of these women are getting advanced cervical cancer. And how do you treat this advanced cervical cancer? Well, the primary treatment for most of locally advanced cervical cancer is actually radiotherapy. And there's only about half of the countries in Africa that have access to any radiotherapy, and even less that have access to quality radiation therapy. So that's a big challenge. And why is that? One, there's issues with human capital, so there's not enough human resources to run it. Second, there's a big infrastructure cost for setting up radiation therapy, even though it's a treatment that's needed to treat 70% of all cancers around the world. And for cervical cancer in Africa, it's about 90%. And even though half of our treatment volume in oncology clinics is cervical cancer, we still don't have access to radiation, to reliable quality radiotherapy, because of human resource issues, because of initial infrastructure investment, and issues around the payment models. So, I think with technology and AI, we're starting to see solutions that will finally have some answers. And I've been treating women with cervical cancer since I finished residency in the US. I moved here, like Ted mentioned, since 2014. And the burden of these cancers is not going down. And what we constantly see is to get women through treatment, there are several challenges. And some of those are in care navigation and delays and patients just getting lost, and having access to quality treatment as well. So one of the applications that we actually built here using technology solutions called OpCare, it's really helped us in communicating with patients so they understand when their appointments are, when they need to show up for treatment so they don't fall through the cracks. And it also really helps us with care navigation. So we know at various phases where the patients are, and then all of their treatment records, et cetera, can be just collected in the same application. And this application is very easily used by our care providers, our nurses, all the health providers in the system. So it's really helped us get patients through timely treatment and improve their quality of treatment, and then also have access to data that helps us improve further. The other solution that's underway is a more AI-based tool. And like I mentioned, delivering radiotherapies, could be challenging, particularly in Africa, because of access to all the human resources, not having access to radiation oncologists, radiation physicists, and therapists. And this AI tool that actually originated out of Australia through Genesis Care, that's really helped really think about how to get the right prescriptions that are evidence-based, and having more automated planning using the AI tool to have quality plans, which will allow us to treat more patients, get more patients through treatment, but not just get patients through treatment, actually get them through quality treatment. So overall, we can actually cure more women. So, so I think, in addition to sort of thinking about public-private partnerships to really set up these centers, really relying on technology and AI is really key to get better treatment, quality treatment, and improve access to treatment.
Thank you, Surbhi. And I think you described kind of that continuum of care. And one of the things that, we don't realize as we're looking at it, and as we're going into thematic funding of where the financing is coming from. I know some of you have financing for technology. Some of you have financing for AI. Some of you have gender lens funding, which Jessica spoke to. I mean, the 15 billion, commitment is amazing. And then all of these also span nuclear science and technology investments. So I'd like to turn it over to Ben. I know the U.S. government is doing a large initiative around nuclear science and technology. And as we're thinking about aggregating it from an end-to-end kind of women's health perspective, and touching upon how Surbhi said for, radiology, for diagnostics, some of you are in supply chain management, how can we look at this also from the program that the U.S. government is focused on related to nuclear science and technology.
Sure. And I will project to reach the microphone. Hello, everyone. Oh, there we go. Thank you very much. It's a great collection of speakers. I think highlighting that one of the most reliable development strategies is always the empowerment of women. I'm Ben Zelisko. I'm from a nonprofit, CRDF Global, that works closely with the U.S. Department of State and a number of government funders to do international development. I run a program called the Sustained Dialogue for Peaceful Uses, which comes out of the Nuclear Nonproliferation Treaty. The NPT has 3 pillars: nonproliferation, disarmament, and peaceful uses. So largely with the IAEA at the fore, the Peaceful Uses Initiative has promoted the peaceful use of nuclear technology, so it is not inherently associated with weapons. And that with a lot of these types of programs, these types of dialogues, one thing that we find is that there isn't a lot of awareness on how nuclear technology can be used, or that in the development community, nuclear technology is inherently seen as suspicious. So the program, the Sustained Dialogue for Peaceful Uses, is funded by the U.S. Department of State as well as the UK government, following a white paper that was signed on by 30 countries to expand the table of conversations about peaceful uses to more than just the typical players, still complementing the work of the IAEA, but acknowledging there are more systemic development issues we need to keep tackling. So, for example, nuclear technology may fail because there isn't awareness of nuclear technology or there's suspicion, but also because there wasn't the financing in place, there wasn't the human capital in place, there wasn't a sustainable project management plan to account for equipment maintenance, or there wasn't proper investigation on the reliability of electricity and networks, or governance models and regulation. So we're trying to build a broad conversation around nuclear technology. To be more specific, in May and June, we're going to be in Jordan talking about water resource management and sustainability in the Middle East and North Africa region. We use, scientists are using isotopic techniques to measure the age of groundwater and how sustainable it is. Nuclear technology is used to irradiate water and waste streams, monitor waste streams. Obviously, there's a crisis of water management in the MENA region. We're also going to be in Ghana talking about nuclear medicine in West Africa writ large, whether it be radiotherapy, better use of medical imaging technologies. Equipment maintenance is a concern. We want to make sure that we are leveraging IAEA resources as well as we can, understanding that they are great at providing equipment and they are great at providing training. We've talked about blended financing models. Multilateral institutions are an interesting player in this space because a lot of people go to them. They are a convener, a great convener, but they have limitations in their bureaucracy and how they can respond to specific requests and how they can monitor data and needs. So understanding they play a critical role at the table, but they're not the only player. And that blended finance models are certainly a no-brainer, but in practice can be very difficult to arrange. And there has to be a really good awareness on both sides of the private-public partnerships of the limitations of each party and how those can be arranged practically. Then we're also going to be talking about agriculture and food safety and sustainability, starting that conversation in Southeast Asia, the use of radioactivity to irradiate food, the use of E-beams over cobalt-60 techniques, which is much safer and easier on the environment, use of it in pest control to sterilize insects. Much better than using pesticides. There's a wide range of applications, and I'll admit I'm a scientist by training, not a finance guy. Talking about nuclear technology, which is one of many tools in your toolbox, as a distinct set, for me, seems a little odd because it's like saying, well, a Phillips screwdriver is this thing and a flathead screwdriver is another thing, and why would we perceive one as the other? They're all just a set of tools. But I think coming back to awareness of what is possible in this space and promoting it in a larger diplomatic context is valuable. I recollect in our previous conversation with CGHD, there was a poll of folks in Africa that over 50% weren't aware of any of the common types of cancers, and that 70% thought that there was no treatment for types of cancers. And so we're in the dialogue business, but obviously we don't want to stop with dialogue. How can we get the right screening data systems in place? How can we leverage new AI tools across the range of the patient experience? And how can we match up opportunities and challenges in ways that haven't been done in the past? So I really appreciate this conversation here today.
Thank you very much, Ben. And I think that's one of the things that, we look at in different ways. And I know you mentioned the investment side, the deployment side, the supply chain side, and we're going to turn to colleagues from MSH and also, Hologic that are looking at different metrics and supply chain management. I think with the nuclear science and technology, in terms of what you said, there's not a lot of awareness. And so I turned to my network of investors and I was connected with Paul Murphy. And I was actually blown away by a lot of the things that are happening related to the deployment of capital into nuclear science and technology, which directly affect women's health, as Ben was saying, in areas of desalination, in areas of medical isotopes that are used for radiation. So Paul, we did a lot of talking, and I talked to your colleague at Cross River Infrastructure Partners. It's amazing a lot of the work that you're thinking about in building these campuses and deploying. If you could share with us, because I really think that it impacts women's health, and you already have large investments into this area. So over to you, Paul.
So thank you for having us. This sort of came about rather quickly, so my remarks will be a little bit all over the place. Being Irish Italian and also a lawyer, I'm never shy about speaking. But I almost brought I have two daughters, 18 and 17. I was like, wouldn't it be great for them to listen to this? And then when I heard it started at 7:30, I was like, well, that ain't happening on a Saturday morning. But it is really great to be here, and it's been really interesting to hear. Before I talk about what we're doing at Cross River, I just wanted to follow on the remarks of CRDF, because I actually teach for CRDF under the FIRST program. So FIRST is the foundation, if I get this right, the Foundation for the Responsible Use of SMR Technology, not one of the State Department's best acronyms in the world. But, the FIRST program has taught in places like Ghana and Kenya already. I've had the pleasure of teaching for both, but also Indonesia. And, it's to build awareness for countries interested in developing nuclear power programs. And it's really relevant when we start talking about projects, because if you don't have the program behind it, there's not going to be a project. And, reference was made to all the things that the IAEA does. And when you think of the concept of nuclear infrastructure, all the things that you need to do from a regulatory perspective, building that awareness is important. For stakeholder engagement, for public support, all of those things, but also for human resources development, to get people excited to come into the field. Because if you don't do that, you're never going to be able to embrace it as a country with your people. I was involved in the financing for the nuclear projects in the UAE, and one of the things they did was they did a lot of stakeholder engagement. And you'd say, well, the UAE is not exactly a democracy. Once the sheikh decides, let's go, you go. But what they realized was that in order to get the best and the brightest of the Emiratis to come into the nuclear program, they had to start at all levels of the educational system to get people to want to go into that instead of things like oil and gas, because that's where all the talent would go. So that's just as an aside, but specific to Africa, I would just note that the U.S. Department of Energy is doing a 24-part series I'm teaching with a colleague, where every 2 weeks we teach on a subject of nuclear infrastructure development, and it's open to all African countries, and it's aligned with Ghana, where it was announced that Ghana is going to be establishing a clean energy training center. So that kind of ties a little bit into some of the things that you're saying, where I think when you look at places like Africa, it's really hard to get stuff done. I mean, I'm being the master of the obvious here. And when you think of nuclear, where that's hard in its own right, and then you put it together with trying to get things done in Africa in a major way, it takes time, and I think that doing a lot of early stage engagement and investment is very important to build the knowledge base and build the support.
Or a roadmap, maybe.
And a roadmap.
Of
course, because I think one of the things, and again, I haven't gotten to Cross River yet, but I think the foundation's important, is one of the things that I've seen in my career is that a lot of these countries don't invest the money early on to set themselves off on the right direction. And if you're a country that's never done major infrastructure in something like nuclear, if you try and figure it out yourself, it doesn't mean that your people don't work hard. It doesn't mean that they're not intelligent, but there's a difference between intelligence and experience. And if you don't bring in the experience, you're going to keep stumbling and stumbling. And, you know, I've done a lot of work specifically with Ghana, and I was asked by the IAEA to review some work that they had done. And it was clear that they spent a lot of time and worked very hard on it. And they didn't get it right at all. And you know, then I was brought in with some colleagues and we worked with them, very open, very receptive to learning. But that difference of having people that have done it before is really important. The problem is those people cost money. And it's very hard when you're looking at something like a nuclear program where the actual result might not happen for 10, 15, 20 years to spend money early on when budgets are tight. And so to get that external expertise, you know, going back to the UAE, they made a decision in 2007. They started writing checks. They brought in the best and the brightest. They moved quickly. You know, not everybody can do what the UAE did. And so I think that's all part of it. So how does this all relate to Cross River and why we talk? Well, Cross River, we're a developer, and we develop technology-driven projects across the clean energy space. And so when you look at what we're doing, I'll just talk very, very briefly. We're based in the United States, but the project that we have right now, one of our projects, is up in Canada at the Port of Baldoon, where it's a phased development where we look at nuclear as a tool. So we're not looking to put nuclear on the grid, you know, just because anybody can do that. What we're looking to do is focus on the applications of what nuclear can do. And so for us, it's a phased development really to produce hydrogen and ammonia. And so the first phase, we're taking available renewable power, because for us, it all has to be clean. And we're sort of getting things going to produce hydrogen ammonia in phase one with renewable power that is either available or to be developed. And that's important, again, because when you think of the gestation period of a nuclear project, if you say, oh, we're not going to be producing nuclear power from the first unit until 2031, that seems far away to people. For people in the nuclear business, that's right around the corner. And just the differences in mentalities and approaches, and especially for policymakers who like to show up and cut red tape and have pictures with shovels and hard hats in an empty field, you know, 2031 is too far away. And so that hydrogen, that first phase is important for us. The second phase, and why nuclear, is because then we really scale. Because renewables are nice, they have a place, but you're never going to get the scaling factors with intermittent generation for the things we want to do to support the hydrogen economy. And so for us, that'll happen later. But what we're seeing already is as this project is going forward, people are saying, I want that too. And we're already signing MOUs with places outside of North America. And the interesting thing about the technology we've chosen, which becomes relevant, I think, to discussions about the developing world, is ARC clean technology. So ARC is an advanced reactor. And the reason we picked it is because the high heat factor. So when you get that heat off of the reactor, to produce hydrogen or ammonia or to desalinate water, you need electricity and you need heat. And if you're trying to create a clean product, and if you don't do it with clean inputs, then you solve one problem only to create another. And so for us, we look at it and say we get greater efficiencies from the electrolyzers because of the high heat factor. Well, that heat can also desalinate water. Mm-hmm. The other thing about the reactor design is it can do medical isotopes. And so I actually, if you'll bear with me for a second, because I have the list here of what we can do as I was thinking, I was just pulling stuff together. But when you look at the isotopes that we can produce from our reactor, if I can expand my screen, lutetium-177, copper-67, actinium-225, yttrium-90, iodine-131, cobalt-60, iridium-192, lead-212, radium-223. A lot of this stuff can be used for everything across the medical space. And so I think when you look at the products that we can produce, you see these projects that could be developed that hit electricity, isotopes, water production. Ammonia can be used for fertilizer. and then of course the jobs and the economics, because these projects are multi-billion-dollar projects.
Prior to the conference, what was interesting is that we talked about, the nuclear power can be, generated electricity. And as, working with my colleague, Dr. Ted, a lot of the times in these projects, we were involved in a $30 million deployment of funding for a project in Kenya. There was nurses, there was oncologists, there were machines. There was no power. And so I think that $30 million gone down the drain, literally, between donors, bilaterals, and some of our women philanthropists, because there's no power. And Dr. Ted Trimble has a lot of examples of that we've discussed, is that I think something like this is very necessary. And hopefully we can put it into that category that I'm going to push some of you on the phone to think about a fund for technology for women's health with a technical assistance card that can help some of the PEPFAR infrastructure, some of the infrastructure we already have in science and technology on the ground. I would disagree with you on the UAE comment, because we worked with the US government and from start to finish through a series of convenings with the investors deployed a $250 million fund. And it was a $20 million cart, and it was 200 and the rest was in private equity capital, which Gerhard was there. It was painful with the USAID legal lawyers, but it happened. And so I think collectively that was 6 months. Let's challenge ourselves in the next 6 months to do something transformative like this.
And I would just finish with the point you're making, which is, de-risking these projects early on at a lot of different levels. But some of the hardest money to find is that pre-FID money. And you don't need a lot of it. I mean, to get to FID with people that know how to do projects, you're not talking massive amounts of money, but it can be extremely impactful to get the project in that space. And so when you start thinking about innovative financing, ultimately you need a good project. If you don't have a good project, none of it matters anyway. But that how to deploy capital at various points of time and mobilize different types of capital that may have different risk profiles. We mentioned public-private partnerships, mobilizing the public to go to private to move forward, but also staging the capital so that some comes in and then maybe gets taken out by other capital that will be more comfortable with the project as it gets further along. So yes, you need the big money, but some of the small money early is often the most difficult to find to get the projects going forward and do all this early stage work that creates project success, but it's people don't want to know. So just something to think.
Yeah, and I'm just, before I turn it back to Ben, just quickly, Gerhard, if you can comment on that, because I know you've done these scaled, I would call them arguments, not investments, because I remember sitting on meetings with the Canadian and the US government for like hours on end, negotiating this type of capital. Who gets 3%? Who gets 18%? And that taxpayers' money can't have a percentage. So if you could talk to Paul's comment on the types of capital that we may need for this type of fund.
Yeah, with apologies that I didn't hear the last series of comments because the mic was off. But let's. I think I got the gist of it.
You didn't hear my comments?
No, I know I did hear your comments, but the
okay.
last comments by the last gentleman there was his mic wasn't working, which is fine. Joanne, you and I have known each other for, I don't know, 10 years, maybe a bit longer. And you've continually encouraged me to launch funds related to various foci to address the SDGs. And over here, in this specific instance, we're talking about women's health. We're talking about focus on gender or on women. We're talking about focus on health. We're talking focus on technology assisted health interventions. That all makes sense, Joanne. The private sector it sounds to me that there's public sector interest clearly in addressing some of these challenges. There's some public sector interest in supporting the flow of private capital. You ask here, in the negotiations, what's the relationship between private and public? Who gets what kind of percent? Who underwrites what kind of a risk? That's all doable. That's not rocket science. That's not nuclear science. the topic of the day. That is all quite doable. We can negotiate that for a balanced relationship. So I would say to your question, Joanne, yes. From the private sector perspective, we would be glad to help build a fund with those around the table today that would come together with us on that, the public sector and the private sector. And we would be glad to build a fund focused on women's health with technology-based solutions. Absolutely, that is quite doable.
So maybe we can get Michael, some of you around the table, some of our women investors and philanthropists. I know, Michael, you said you're thinking about blended financing. Ikuyu from JICA, I know in a couple of weeks you may launch a blended financing, so maybe you would benefit, some thinking there. I know things happen quickly, but this is in these types of conversations that we can maybe think about. You have a willing investor. I know that. So a bit of background. Gerhard worked with Mother Teresa, and so when you ask him on returns, even though we know he has investors he's liable to, getting creative on the technical assistance part has always been possible. So I think as we're thinking about these blended financing funds, we have the right time, we have the right momentum, so let's use it.
Joanne, I was recently speaking to an MBA class, and I mentioned Mother Teresa, and I got a bunch of blank stares. 30-year-olds don't know who Mother Teresa is, so you're dating me.
Yeah. The only thing that I would add to all of this is that we need money, and we'll take any money. But as long as it's not for like North Korea and Russia and China, or Iran. But the thing is that with our project in Canada, our engagement with the First Nation communities has become exceedingly important, and they're going to be a participant in our project. And as soon as you get certain groups into a project, I'll call it a multiplier effect, for lack of better phrasing, that in Canada, there's always that question, well, how do the First Nations feel about your project? And if you don't invest that time, your project's going to fail. But when you can show that it has significant support, it elevates the project. And I just think that if you're thinking about money that has under the umbrella of gender money, women's money, whatever the right word is, that if you get that support into a project, that will get unique attention, especially when you're trying to do a project in hard places, or with us, our project is many things, but an element of it is nuclear, which creates certain sensitivities. You get women's backed financing in, it has a multiplier effect, not just on the money, but in terms of the goodwill, the stakeholder engagement. And that's a very powerful thing. And it's going to get other people's attention.
Yeah. And we always say it's not lack of money. I know you think there's lack of money. It's the story that the money tells, right? And so if you can aggregate enough stories, and I don't think there's stories, but we're genuinely working here on end-to-end women's health, all of us in different ways. And I'm conscious of time, so I'd like to turn it over to our colleagues from Hologics, because I think we can build the funds, but we need the data as well, right? In terms of the deploying a capital, in terms of, we talked about briefly about a roadmap, right? So where is the de-risking capital? Maybe the roadmap should say, what are the priority countries that have de-risking capital? Because governments around the table have those priority countries already outlined. I'm sure, Colin, you have priority countries already in de-risking capital. What are the technical assistance monies out there, both private equity? Gerhard, I know you have technical assistance money out there too. And some of our other investors who are listening online and our women philanthropists. What does that look like? And then what are the top programs that we can quickly scale in this area? Because we have companies, because we have diagnostics, because we have small nuclear reactors that can create those campuses for desalination, clean water, and access to birth. I mean, not to deviate, but I know so many women that have died because there is not access to clean water, and they're getting infections and in childbirth. So as we look at that, if you can give us a little bit, because I know you've done a report, and how we can maybe put together again, I'm hopeful. I think the fun will be easy, but that roadmap of where we all go as partners. And then I think we're going to hear from on the supply chain side as well. Over to you, Susan.
Thank you. So I'm Susan Harvey, and I work at Hologic, which is a technology and medical device company focused on women's health. Every conversation, I feel like I can link right back to women's health and how we can use women's health as a foundational component of human health, families, communities, and economies. And we've heard already, if we close the gender gap in the workforce, $28 trillion, somewhat magically in my mind, because I'm a physician, not a finance person, will appear in the world economy. It's fascinating to sit in a group of people where I don't have to convince you all that women are important. Usually that is my biggest role. So the 4 billionth female was born about a week ago on our Earth, which is pretty amazing. The work that we've done to gather data at Hologic is it is a publicly traded for-profit company, and number one is the street. There's no question about it. Yet truly, the Hologic Global Women's Health Index is not about the commercial component of Hologic. It is about the need for measuring something you want to impact. And Hologic does want to impact women's health. Do they want to make money when they're doing it? Of course they do. But this is a component. So we partnered with Gallup, realizing that there really isn't women's health data out there. It's not owned by any individual structure or group. And we partnered with Gallup and tagged on to their world poll 10 questions about women's health. We asked women and girls 15 and older, boys and men 15 and older. So we have some gender gap information in there as well. 122 countries in 2021, we were able to pick that up as COVID is tailing off to 143 in the data from 2022, which is getting analyzed right now. So we lag a year. What we found in this information is that there are 5 dimensions of health, broadly speaking, that explain more than 80% of the variation in women's life expectancy. And they're pretty obvious. Right? Preventive care. What women need is that we detect deadly diseases early. Women don't have diseases. Women don't die of diseases we don't know how to treat. We simply don't treat them. Emotional health, which we all know is related to mental health, negative emotional health in the long term, as well as physical health. It's best documented in cardiovascular disease, but it runs the gamut of all health. We are at an all-time low. Gallup has been asking about emotional health for more than a decade. Interestingly, not causal, but associative. Just before the Arab Spring, emotional health plummeted in that region of the world. So it has an impact on how we live each and every day. Individual health, meaning what are the limitations that you have based on pain? There's a huge gender gap in pain, and also chronic health issues which limit activity. 25% of the women in the world, now we don't get all 4 billion because we're 15 and above, but 25% of women 15 and older tell us that they have pain and chronic disease that limits their activities. They are not going to participate in our workforce if they're too sick and disabled to actually do day-to-day activity. Opinions of health and safety. If women are not safe, then they are not going to engage in care of their families, communities, or the economy. I'm going to try to I'm going to try to be financial here as far as it goes. And what we learned is abysmal. About 1 billion women told us they did not feel safe walking alone at night where they live. And we also asked about domestic violence. One cannot ask, are you a victim of? But we can ask what's your perception of it. In the United States, 9 out of 10 women answered, it is a big problem where I live. And globally, it's a bit lower than that, but not a whole lot. Women are more aware of it than men. That is not going to surprise anyone. Part of what we are doing is validating assumptions that we all have. Basic needs. There are 1 billion women, and this number is likely to skyrocket with the war in Ukraine and grain outputs, massive drought in the Horn of Africa. 1 billion women told us they were food insecure. Women feed their children, and women tend to eat last in most cultures around the world. It is a big problem, and if you do not have food, you are not going to get health care. So this framework allows us to understand the current state of women's health, but it also gives us a roadmap, a framework to look forward. And what are the priorities in regions or countries? What do we need to focus on? What do we need to invest in first? And how do we make those improvements? It'll be step by step. It'll take a long time. Colin and I were talking about breast cancer. It's not that women in sub-Saharan Africa don't know they have a lump in their breast. It's that what they do know is they will die, they will cost money, and they will need support from their families. They are at risk for their husband kicking them out with all their children. So what's the best choice in that situation? These things will take time, but if we have a framework and we follow SDG number 17 partnership, we may actually make progress in this. There's so many connections. First, I want to thank PEPFAR, because PEPFAR put a healthcare structure in sub-Saharan Africa that did not exist, and we should all be leveraging. And if we look at PEPFAR, only a third of the women in the world have their blood pressure tested. How about if a PEPFAR clinic puts a blood pressure cuff, right? And we expand on what's there without a huge cost in resource use, and think about women's health beyond reproductive health. Not that reproductive health isn't important. Maternal mortality, maternal care speaks to women's opportunities, to women's empowerment, to women's rights, but it goes beyond. And I think it's probably time for me to stop. And I'd love to answer more questions.
No, thank you so much. And I think we'll take on, kind of that idea of that roadmap, because you do have some data. You've used the Gallup poll. I think those are some metrics that we can build upon. As I said, some of you in the room have financial data. If we can concentrate among a group of partners in the deployment of capital, in terms of those case studies, one a large fund, but maybe some individual projects that we're going to hear around the room. Because when we did create those larger funds, what we found is those people that couldn't give large capitals to the 200 something plus $1 million, they actually did bilateral, negotiations, whether it's technical assistance or private equity capital, and those were really impactful as well. And so I think let's look at that. I know some of you have to go, so I'd like to turn it over to Leslie, who's looking at, she's Chief Executive Officer of GBC Health. GBC Health has done amazing things throughout the years, and now Leslie, at the helm of it, is really looking at transformative areas, and especially now you're convening a meeting on Africa and the UK. Leslie, if you can talk about some of the initiatives, your thoughts on the conversation to date, and I know you're in the UK right now, so over to you.
Yeah, thank you, Joanne, for inviting me to be part of this absolutely fascinating conversation. And you mentioned the Africa UK Summit, which is taking place in London on the 24th and 25th of April. And we're bringing together social impact investors, entrepreneurs, health professionals, ministers of health, permanent secretaries from 12 countries, really looking at opportunities to create business partnerships to improve health outcomes. But I just want to step back a bit to a series that GBC Health did in 2021 and 22 with Wilton Park in the UK, looking at blended financing to improve health outcomes in Africa. And we brought together a blend, if you like, of government, investors, donors, foundations, and entrepreneurs, along with academics and NGOs. And we ran the series over about 15 months. And two of the events that we held, one in Lagos and one in Nairobi, were Dragon's Den style events. And so we selected 5 or 6 entrepreneurs to come to each meeting and pitch to 4 or 5 investors in the room. And what we heard back from the entrepreneurs, and we heard back from the investors as well, is there was some incredible opportunities and some great stories, but what the entrepreneurs were not really doing was explaining the business case or their business model. And they weren't really able to pitch their value proposition in a way that was landing for the investors. And so from those 2 events and the series generally, there came a demand that there would be some kind of vehicle that would do 2 things, would create a marketplace to bring investors and entrepreneurs together, but would also provide support and mentorship for entrepreneurs that had proven solutions that were clearly ready to scale, but they needed some help to get them over that next line. So from that was born the Academy for Health Entrepreneurs Africa. Our aim is to develop both online and in-person training resources to reach out and recruit mentors from business and from investing, and to create, if you like, a masterclass that would be a 3-month package of online training, in-person workshops, pitching and mentorship that would really help move some of these investable opportunities to a position where they were able to actually meet and unlock that funding that they need. So we're working with our sister organisation, the Africa Business Coalition for Health in Nigeria, and we're working with Total Impact Capital as well. And so what we're trying to do is bring together both public and private sector stakeholders so that we can leverage not just funding, but the intellectual capital that many of these players can bring. And the idea is that we'll create the platform for the Academy. We will go out and call for applications. We will have very stringent criteria to select each cohort and take them through this particular process. The other thing to say in relation to the Academy is it links to the GBC Health Future United Collaborative and the awards that we give out each year under this initiative. And so we did our global awards last year and awarded 5 outstanding individuals and organizations to recognize the work that they're doing in sub-Saharan Africa and more widely. And what was really interesting, looking at the 150 plus nominations from over 40 countries, many of them were women-led or women-founded, and many of them were about women's health. So we now have an amazing database of entrepreneurs and innovators doing work not only in Africa, we also had representation from Southeast Asia and South America. So we're beginning to develop a bit of a pipeline, and we can invite some of these entrepreneurs to go through the Academy Masterclass to really help get them investment ready. We launched Future United Africa Awards a couple of months ago, and of our 5 finalists who will be pitching at the summit next week, 3 of them are women-led, and all of them are investing in women's health. So what we've been able to surface through the work we've been doing and across our network more broadly are the kinds of innovations using technology, AI, and other solutions that don't typically get recognized. They're not the big companies that usually get the investments. Some of our entrepreneurs are looking for no more than $250,000. Some of them are looking for 3, 4, 5 million. So we're not talking huge amounts of money here, and yet they can make transformational difference, particularly for underserved populations and vulnerable populations. So I'll stop there because that's really giving you a flavour for the Academy and the entrepreneurs that we're surfacing through Future United.
Conversations in the UK, and we'll discuss more on when, because I think joining some of these discussions on how we create that roadmap or build this potential fund and scale the case studies would be great. I want to turn it over to one of the women investors who Megan, I find transformational in terms of the investments you made, and I wanted, while you were out, the group has been talking about potentially, a fund for technology for women's health. I know you've structured some of these, and I know you also are an investor into a lot of technologies related to women's health. So if you could give us some overview and your thoughts on it, Megan.
Sure, absolutely. Thank you so much for having me. And I I think it's interesting that, so from my perspective, I partner at a fund called Amplify Her Ventures, and it's profit driven, right? We're investing into companies founded or led by women for the purpose of generating ROI, because we truly do believe that investing in women is a value creation opportunity. And I think from that vantage point, there is so much more going into this conversation and the incredibly impactful solutions that have been discussed and presented too. So for context, the impetus for my venture fund, Amplify Her Ventures, is that 2% of venture dollars every year go to women founders, right? Only 2% of the billions and billions invested into venture-backed companies. And yet, what we found when we really looked at the numbers is that something like 63% greater ROI is generated by companies with diverse leadership teams, or at least one woman involved. And when you put those numbers side by side, you see just a very logical value investment opportunity. And with that, about 5 years ago, we launched Amplify Her Ventures and have since made 40 investments, many of which are in the healthcare space. I personally have a very strong healthcare thesis. And the thinking there is that, well, if you also look at the stats, women are 2 times more likely to invest in other women. And extrapolate from there, innovate for women. So the fact that technology and innovation has come so far, and yet there's still such a lack in transparency in our own day-to-day wellness and access to healthcare on a global scale is incredibly mismatched. So yeah, we've made some very compelling investments into companies that make healthcare more accessible and scalable. For example, we recently made an investment, I don't know how much I can share at this time, but like investment into an AI software that can detect cancer earlier, particularly those cancers that to date really have only been able to be detected by the time it's effectively too late. And another one is on the preventative side, an at-home hormone test for women to take control over their own bodies and understand when they're able to get pregnant, when they're going through menopause. So putting technology into the hands of the individual in order to take control over their own day-to-day wellness and health and access greater healthcare in doing so. So I'm very much a fan of all that Joanne and your whole team is doing, because not only is it making waves and benefiting us all on a macro level, but it's also a very smart, profit-driven decision to invest in women. So, in my opinion, I'm happy to share any more details there.
Thank you. And we'll, we count on you as a part of WEN. So we'll be tapping on you as we're designing this broader fund, and then also the roadmap. And with that, I think one of the key things is political will, right? Because we can have all the money, we can have, the systems in place, but if we don't have the political will, sometimes that stops a lot of the investments on the ground. So I'd like to turn it over to Ricardo, who I was first introduced to by Michelle Sidibe, and watching your career grow, and now founder and president of this global parliamentarians for global health. I think that's a bit of what we need is political will as we're sort of implementing and getting the money together, getting the roadmap, but we need the political will on the ground.
Thank you so much, Joanne, and thank you for the kind invitation. It's great to be here. I'm not Irish Italian, but as a parliamentarian, I can speak a lot also, but I'll try to keep it short. Just to say that we heard throughout the different very interesting interventions a lot of the challenges that are also faced in trying to deploy investments and achieving the maximum impact when having this gender-focused investment around the world, and particularly in low and middle income countries. And they are governmental related, bureaucracy, political will, as you mentioned, Joanne, but also other challenges like de-risking, which governments can play a critical role, And even when we talk about technologies, the ethical challenges. And so I'm basically here, I would say, with two hats. One is as the president of the Unite Parliamentarians Network for Global Health. We are a network of current and former members of parliaments, congresses, and senates from 97 countries around the world. And we work precisely in trying to translate science into policy and supporting our parliamentarians to precisely solve many of these issues on the ground. And looking at this from a gender lens, if you will, there are many initiatives that we are discussing, and I think that there is room for collaboration. And because, you know, we do not, in both of my hats, we do not bring in money to a fund, but we can help solve many of these barriers that, in a way, impede that this fund can achieve its maximum impact. And so looking at our women MPs and parliamentarians and creating a hub focusing on their work, working on what we call policy desks focusing on women's health. Our policy desks are specialized teams that focus on vertical approaches to policy, focusing on concrete changes in policy we want to achieve to be able to solve those problems in certain countries. Just a very concrete example, we have a policy desk on digital health, where we are working in India, Tanzania, and Argentina to solve many of the regulatory and political challenges that we are facing. And we've been working in this desk for about a year, and we have already achieved with our MPs, we're nonpartisan, so we work across the aisle, and we have brewing in the Argentinian parliament in Buenos Aires legislation to create the first health data agency in that country. And so these are the kind of initiatives that we can actually push for. And if we have a verticalized approach when it comes to women's health, we can also have impact. Another area that we believe can be very impactful is a new project that will be launched at the World Health Assembly in Geneva, which is our Global Health Policy Lab. It's a collaborative between Charité University in Berlin and the Harvard School of Public Health here in the US. And the Global Health Policy Lab is working on developing a digital repositorium of all laws and policies in the health space from around the world, and to put it in one digital space with the structuring data that allows us then to apply artificial intelligence to policy making. And so to look, because this is all building up from our experience, when we face a challenge when in the policy space, policymakers are constantly reinventing the wheel, sometimes applying policies that have failed, or sometimes not achieving maximum impact that policies could achieve if we had built on this collective intelligence. And when we do look at best practices, they're normally anecdotal. We normally look at examples coming from English-speaking countries. There are amazing policy innovations from around the world, even low and middle income countries, because of the resource scarcity that we can build on. And so that's another area, I think, of great risk. And through that, we have already started to develop we've done it in hepatitis C, we've done it in flu prevention, what we call policy calculators. So these are apps that anyone from a journalist to a minister of health to an epidemiologist can use the app and actually play minister of health in their country and see how the different health policies have impact in terms of health outcomes, economic outcomes. And it's great because a patient advocate meets a minister of health in the elevator, opens the app, and in 1 minute can show the impact of the policies, not just today, but 10 years from now. But the minister can present those results today because, as you know, policymakers have very short life cycles, ministers of health even greater. And so, and we do like to cut ribbons. And so to present results, and, you know, elections are important, but to win elections, you need to present results that are important to constituents. The second hat, if I just may have one more minute.
No. So on that,
sorry.
I think, no, you can have one more minute, but on that, I think you should add financing to the app. And so as we're thinking about the roadmap here with these partners and you have the data, maybe you're already creating the app. Let's think about the financial component within this app as well.
Now, that's a very important component. We talk a lot from the scientific perspective. I'm a physician in infectious diseases by training. We always look at cost effectiveness. When I got into politics, I understood that that is absolutely useless conversation. So because when you present something, you're presuming that it's cost effective. It's a question of affordability. And so Unite is focused, actually, I'm in DC because we had a session at the World Bank Spring Meetings focusing on sustainable financing for global health and innovative financing. Of course, all of these things that we're discussing here are interconnected. And you're absolutely right. How much does each policy cost? What are the impacts? What are the economic outcomes? We are in the app for flu prevention, we already have social impact and economic impacts in terms of workday productivity loss, but we can go much further, exactly building on the data and showing that impact. The other hat that I'm bringing is a new position that I'm taking up in May, on May 22nd, which is as CEO of an organization called IDARE. It's the International Digital Health and Artificial Intelligence Research Collaborative. It's an international foundation based in Geneva. And through that, the main focus that IDARE has is looking at digital health and AI as public goods and public tools, and solving many of the problems, particularly with a particular focus on low and middle income countries and small states. And just a couple examples of what IDARE is already doing, so not under my leadership, but I believe it's very important. With the support of the Canadian government, they are currently developing solutions focusing on responsible AI and gender responsive AI, which is very interesting in the sense that it is developing an open source kind of stamp of approval for future technologies in this space, putting that gender lens. And these are the kind of solutions that we believe that platforms that are neutral, UN, WHO supported, like IDARE, can provide these tools so that other commercial solutions or non-commercial solutions can build up in a way with this stamp of approval that provides us with the trust that is needed because of the ethical challenges also that are underlying. The other is the research infrastructure. IDARE has developed what we call the AI Lab in a Box, which is a technology that is being deployed to different parts of the world, particularly low and middle income countries. We call them nodes. And these labs provide the technology needed so researchers at a local level can develop AI solutions, and a new language codex has been developed. So you don't need extreme expertise in artificial intelligence to develop these solutions. And this is working as a federative model, so a decentralized but integrated model of research infrastructures that will then lead to collective growth in terms of data sharing and solution sharing. And this, I believe, will have a very important impact in low and middle income country settings, because we want, many of your companies are focusing on artificial intelligence solutions. You need to make sure that locally you have the infrastructure needed to make them sustainable and grow locally. And so I think there is an overlap here. And so these are just some ideas that I believe are interconnected to solve many of the barriers. That's such a fund with a gender focus and technology. I believe that we can work a lot together.
Is that you saying that you're going to join the working group for creating the fund?
I basically invited myself.
Yes, you did. Yes, you did. Because I will, in a second, turn it back to Gerhard. Don't leave. Because you have a mechanism to build a fund to do this. So I'm going to challenge all of us to do that. Vinay, we talked about policy, and at a high level, I'll let you introduce yourself. I've known Vinay for many, many years. I think at a head of state level, you've dealt with many African heads of state and have been very diplomatic at negotiating very difficult decisions. I think one of the things, as Ricardo talked about the parliamentarians in all of reality, is that if we create such a fund, I've seen the deployment of capital into these investments be blocked into the African continent at times, because you don't have the policies and you don't have a head of state kind of support for this type of sustainable financing mechanisms. So if you can talk in your hat as UNAIDS and also your previous experience, what do you see here in terms of the conversation and the sustainable financing for these initiatives for women's health and related to HIV/AIDS and others?
Thanks, Joanne, and thanks to you and your team for convening this in a series of really important conversations. And on behalf of UNAIDS, which is not a UN agency, we're a joint program, so we actually have 11 co-sponsors. So WHO, for example, is a part of UNAIDS. UNICEF. I won't go through the whole list, but it's great to see all of you here, and all of these discussions I will share not only with our leadership that has been in DC this week, but also with our co-sponsors on how to take some really practical steps to move it forward. Just a few background words on where we're at in terms of specifically financing in the global HIV response. There is this misnomer that the vast majority of funding for HIV actually comes exclusively from PEPFAR and from the Global Fund. The vast majority of international funding for HIV comes from PEPFAR and from the Global Fund. But well over 50% of all the funding for HIV in low and middle income countries actually come from domestic governments themselves. And now in this new, we're not quite in a post-COVID period, but as we move from the experience of COVID, we're seeing that the fiscal space for low and middle income countries is increasingly tight. And actually, in partnership with PEPFAR, the US Treasury, the Global Fund, UNAIDS, we convened a really interesting discussion yesterday at the IMF with 12 ministers/ministries of finance at very senior levels, ministers in the room from sub-Saharan Africa on specifically the sustainability of HIV funding in sub-Saharan Africa. And I was particularly struck, without pointing any fingers as to who said what, there was a very high level of commitment by the ministers of finance on the importance of sustaining and increasing and enhancing financing for HIV, but there was a very mixed, in some cases, quite a low level of sophistication on how much they're actually funding themselves on HIV domestically, and what are the practical steps, and how can they work with blended financing tools and with private sector partners on filling the large and growing gaps we have on HIV financing to really get to sustainability roadmaps. That's why UNAIDS worked with Economist Impact earlier this week. Some of you were at the launch that we did of a report called The Triple Dividend. And this really looks at not only what's the impact of HIV financing for HIV, but what are the positive spillover effects of HIV financing for health more generally, for health system strengthening, for social and economic development, with some projections between now and 2030 on what does optimal HIV financing look like for generating positive spillover effects for, I think it was 13 economies in sub-Saharan Africa across the board, and not just for HIV outcomes. So we're, as UNAIDS, we're very focused on not only supporting work to end AIDS as a public health threat by 2030 and working with all partners to do that, but also on how do you close the gap for financing. And as Mike said earlier, and I've heard say several colleagues here say today, we're not going to close that gap only by looking or trying to squeeze more juice out of the same partners, the same donors, even the same governments. I think the partner governments can do more, but they're looking for partnership and expertise, including on blended financing models, to take it forward. Particularly on women's health, it's no surprise that HIV continues to disproportionately affect adolescent girls and young women, particularly in sub-Saharan Africa, for a combination of reasons that we all know. And there's a lot more work that needs to be done, as other colleagues have already mentioned, on really urgently scaling up the work on not only HIV prevention for adolescent girls and young women, but also the other related health risks, including cervical cancer. There is an amazing Go Further initiative that we work on with PEPFAR and the Bush Institute, but there's much more work that needs to be done to protect adolescent girls and young women in sub-Saharan Africa, particularly from HIV and from cervical cancer. I'll stop there just by 2 quick points. One is that Joanne, you and I have discussed over the last few months, UNAIDS is happy to join the Women's Health and Innovation Network and really take some practical steps in the next few months on how we can contribute to the work, particularly in sub-Saharan Africa, on moving forward blended finance and new funding initiatives to really help close some of these gaps. And then finally, I'm probably not well qualified to tweak African proverbs, but we've all heard the African proverb about, if you want to go fast, you go alone. If you want to go far, you go together. But we're, at least in HIV, we're in this strange space now where we need to go fast and we need to go far and we need to go together. So we're really looking forward to working with all of you to take some of those next steps. Thanks.
And thank you for offering to join. And I think as we see it, there are practical steps, right? We talked about a roadmap. We're talking about case studies that we have a couple of speakers talking about. And then we have this sustainable financing mechanism, for technologies related to women's health that could invest in, some of the work that you're doing related to AI and those AI hubs, which it could be transformative. I'd really like to get us a little bit more concrete, and we have one willing participant. We have two in terms of Ricardo, maybe Susan from Hologics, CRDF. I know you're a partner of ours. Are there others in the room, and Gerhard, I don't know if you had a comment, who will want to join these kind of working groups as we're creating this, fund for technology for women's health, and also this roadmap of investment? Are there others? Gerhard, not to put you on the spot.
Well, definitely, Joanne. You started the meeting by saying we need to be practical. We need to be real rather than being a talk shop. I agree. I would suggest that you convene a group, a task force, or whatever. I'd love to have Leslie Ann from GBC Health there as well. I'd love to have Jessica from 2X Global there. We need people who can not just talk, but who can also contribute capital. We need the public sector funders there. We need the structurers there. Let's do this in a very practical way. Joanne, you're the convener. I would say within 2 weeks, within 4 weeks max, we have a meeting. Otherwise, we need to go fast, as Vinay said. So let's do it.
Here, both from USNCI, from CRDF, from Michael. I'm going to put you on the spot, US PEPFAR, hopefully to join as you're structuring your sustainable financing. I know that Ikuyu left us, but they're going to launch something at the G7 in a couple of weeks. So we need him in those discussions as well. As a done deal, we're working on those two, kind of next steps. And yes, I think we'll convene a meeting in 2 weeks. And Colin will tap on British Invest International expertise as well, as we're structuring these different two vehicles. And one of the things I don't want to forget is kind of also the essence of, we create a vehicle, we create a roadmap, we need a delivery of services, we need that supply chain, the actual people that are getting to that last mile. And we can't forget that. So Marianne, I've also known you for a long time, but you really are creating innovative supply chain solutions at MSH. And if you can also work with us and comment on some of the work that you're doing.
Yeah, thank you a lot. I don't get to talk about health and business very much, and I certainly don't get to talk about health and business and women all at the same time. And I've spent 3 decades of my career in that space. So thank you, everybody. This has been an exciting discussion all day. I'm the CEO of Management Sciences for Health, and we're a nonprofit organization that strengthens health systems. We're operating in, I think, 49 countries right at the moment. A lot of them in sub-Saharan Africa, but we're on 4 continents. We do work when you think about the health system, supply chain is a huge piece of it. And more our work is in either supply chain or health financing in one way or another. And we work with governments and private sector and civil society, across the gamut. The specific use case I wanted to talk about is a purchasing platform in Kenya. Because I think it's an example of how we can get to a place where we can deliver more care. And it resonates a little bit with a use case that Colin brought up at the beginning of the day. MedSource is a purchasing platform for healthcare products. And what it does is it disintermediates mostly pharmaceuticals and medical agents and things like that. We work with the largest international manufacturers, multinational manufacturers, wholesalers, et cetera, to help small pharmacies and second-tier hospitals actually get access to those products that are decent quality and much lower prices. And the business model for our QBC friend is it's a little bit of arbitrage. We take a tiny little percentage and we're still able to create, much lower prices for our pharmacists. And when we do that, so it's a technology platform, when we do that, we actually find ourselves accessing a large number of small business businesses. We've got now 750 outlets in Kenya, covering about 80% of the population. 35% of them were women-owned businesses. We doubled last year in size. This year, we're on track to quadruple in terms of the amount of products that are trading. So we're taking excess costs from intermediaries out, and we're increasing quality of medicines. So we can track and show you all the women's healthcare products that are going through the platform. It's an amazing opportunity. It was super crazy of an organization like MSH, which is a nonprofit organization, to actually invest in something like this with our unrestricted funds. To those of you who know our world, know that that's just a dumb thing to do. And we're really proud of it. I think it has an opportunity to scale more broadly. Because as I know, we work in many of these other countries and we know that the climate is similar. So let me stop there because I could talk all day, as Joanne knows.
No, and I think you can talk more when we're designing, right? So that's where I challenge all of you. I'd like to bring in Liz. Liz, what you've missed is that we have talked about a potential fund for technology for women's health that would look at diagnostics, lab equipment, issues of nuclear science, supply chain management, biometrics, artificial intelligence. Am I missing anything, anyone? And a technical assistance card, because you haven't heard from our colleagues in Ecuador. There's parts of this that cannot be, private sector focused and can't have return, but you do have that technical assistance component, or as Colin talked earlier, that gender card or the technical assistance facility that we could put together with a for-profit fund and deploy capital together. So it's more efficient in these areas of biometrics, nuclear science, and end-to-end women's healthcare. So Liz, I know you're doing a lot in supply chain management. You guys are thinking about, supply chain management from a hub and spoke model into getting into the African continent. You've done a lot in Ebola, COVID-19. We've worked with you on some of those negotiations with the U.S. government around Ebola and also COVID-19. And I know you're, as a company, you think creatively around these issues. So I'm going to drag you into these groups. And then also if you can comment into some of the things that you're thinking about as well.
Well, thank you very much. First of all, apologies for being tardy to this very important session. I think supply chain is really at the root of what needs to be, thought through in order to get medicines to where we want them to go. And that's really my focus. I work for Gilead Sciences in a division called Global Patient Solutions. We're responsible for ensuring that medicines available in first world countries make it to the developing world. So the entire continent of Africa, South and Southeast Asia. And I manage the voluntary license for Gilead. So I work with a lot of our Indian generic manufacturers and others. We have one on the African continent in Egypt and one in Pakistan. And some of the things that we learned for sure, me being directly involved, was, we often hear, IP, we have to, allow release of IP in order to, let these medicines, innovative medicines, not the old ones, but the brand new ones, which we did for remdesivir. We made it available in the developing world before we even had full FDA approval, which is, I think, unheard of. It was not IP that held us back. It was most of these countries. So we had a license that allowed 127 countries to have access to generic versions. More than 8 million treatments, not vials, but treatments were made available. And of those 127 countries, about 60 of them did not receive. Now, that could be many reasons. Could be they just never ordered. We certainly never had a situation where a country needed and they didn't get. But what we have found was, and the feedback we heard from our licensees was, the lack of procurement systems in a lot of these countries. And that's a critical component of supply chain. And so I think we really need to help those countries. And I think, women, anybody can help in that space, but I do think it's quite tedious, that entire procurement process. And many of these countries, the data shows, will rely on women. So we need to empower them. I'm happy to say that at Gilead, 9 of our senior level, C-suite and above, of the 9, 5 are females, and the head of our product and manufacturing development and manufacturing is a female. So we truly believe in empowering women in this space. So I'm super thrilled to be part of this conversation, and I'd like to take it, as far as we can, case studies and the like, to see how we can help these countries if we truly want to be prepared for that next pandemic. It wasn't lack of product. It wasn't, IP standing in the way as a barrier. It's procurement systems and, the supply chain component within these countries. So thank you, Joanne. I don't know if you know pretty much everything I'm working on. So if there's something I missed that you want me to share, please let me know. And Gerhard, I see you nodding, and always good to see you.
I think one of the things is the technical assistance facility, as we're looking at, this fund is really, you mentioned barriers to procurement. So looking at that supply chain case study. So some of it, we talked about, the technology for women's healthcare fund that we're going to help structure with some of you in the room, the roadmap. But it seems like, the barriers to access and that supply chain is really necessary. And I don't know if that's addressed from a technical assistance perspective or from a private sector, private company perspective, or it needs catalytic component on its own as a funding source. But definitely, Liz.
All of the above, I think.
If you could join us in these working groups to help kind of figure that out and I would set a timeline for us, right? People like announceables at UNGA. Let's figure out what we collectively as a group can do in these 3 areas before UNGA with some catalytic capital. I'm going to turn to our women philanthropists that I know are online to help us with some of the capital to de-risk these initiatives and try to move this forward. And some of them, the case studies on technical assistance, if you can, speak to that, because I've attended an amazing set of events that we co-hosted with USMCI, and Harvard Global Surgery Program. And it was transformative for me to see how much political will you had in Ecuador, as we've been talking about the will. And as we're looking at this, some of the case studies will just need technical assistance. And so if you could provide your overview, and really impressive that you have support at the highest levels from the Vice President to execute these end-to-end solutions for women's health.
And Joanne, if I could just add one other thing, another learning, right? Pandemic in particular, nobody expects it. Nobody expected COVID. And there's a regulatory component to making medicines or enabling medicines to get into countries. WHO plays a big role in, pre-qualification. If there's no pre-qualification or the product doesn't come from a stringent regulatory authority, right? US, FDA, Europe, Australia, Japan, the funders, the UN funding are not able to purchase product on behalf of countries. And so, volume commitments from organizations that have the ability or in that, space is also quite helpful. Probably a lot of these countries that didn't have funding and were not able for those reasons to obtain funding. So I think that's also something that needs to be considered when we look at these case studies.
So we're talking about marketplaces and supply chains, but what else has come up in technical assistance is how to navigate these systems. Can we integrate in these marketplaces where we're normally buying medications, the ability to quickly access a consultant to understand how to make a business case, how to operate the regulatory infrastructure? Can we commoditize the unknown unknowns in the space?
Yes, it's a quick answer. I want to go back to the regulatory piece for a minute, as I had a chance to tour the vaccine site in Dakar in Senegal recently. And I'm very aware that the regulatory agency there is ML2. So they can't do local batch release once they do have vaccine capability. And that happens all over the place. And I run an organization that knows how to do regulatory system strengthening, and we do it in a number of those other countries. But getting the funding for it is and first of all, getting an appreciation for those technical details. You know, they're just sort of so behind the scenes that it's hard to it's hard to get folks together to get things done. And no offense to the donor community, but you know, they make their choices based on what they're looking at, and thinking about how to structure the business so that you can get the health work done is a very difficult thing to do. I think Michael talked earlier about doctors and business and government and trying to put those things together, and they don't go together easily. They can, turns out they can, but they don't. So when you talk about purchasing platforms, one of the things we do is we actually put financing on top of it, because we can identify the business leaders who need inventory financing, and then we can connect them to financial investors. Once you start working in one part of the chain, you can connect many other pieces of the chain together. So I think it's a great question. Thanks.
And you know, I'm glad you mentioned that, because there are a lot of those
Thank you very much.
components.
It's a pleasure for me to be here and just to speak a little bit of how we've done in Ecuador. First of all, I have to thank to the program of global surgery that has been one of the greatest point that we've worked together and that we've had the chance to be here talking about this. How you move in South America, and I think that that's the case in Africa also, how governments change so rapidly and how things cannot be done on a long period of time. And as it was said before, we need to find these things that actually work, that actually people are going to vote for the same line that you're going on, and how we make it cost effective again, and how we make it that these budgets that we have that are struggling every time and that we have a lot of needs, really take the time for the government and for the people who are making decisions just to be involved with that. So for us, it has been easy, as our vice president is a neurosurgeon. So he already knows why health is important and why health is connected to development and to economics, and how we can actually measure the state of the illness, of mortality, in terms of how it really impacts on economics. So how you move a tiny budget into making efficient budget. And that's the gap. If we continue spending money where you cannot get anything out of it, then it's you're spending money, you're not investing money. So what we have done and what we are trying to do is just to change the things, and you cannot change it from one day to other. It takes years, even to see a real mortality change or a change of the status of the health of the people there. It's going to take 10, 15, 20 years, and it will actually change once the government is changing along. So the best part, or the most important part, is to build from local. And I always say that if you institutionalize everything and you make people want to have that access, or if you make people be worried about getting the medications, getting the vaccines, getting everything where they are supposed to be, then even though if the government changes, it is not going to change what people need. So one of the most important thing is to build the necessity at the lower part of who actually needs the vaccine, needs to be aware that there is that need, in order for the next government not to just change the budget to build something else. And that's what makes what we are doing right now is what we're intending to, because we know that we have short periods, really short periods and when you have countries like ours, it's hard to see how it's going to be if we are going to spend it for years or not. Then you need to make changes, but you need to make changes inside the community. So once the community wants that change and you bring up that need that they have, they are going to fight for it, because they know that what they have will be better for their lives, and that will help with the economic development in that region. And that's been really important for Mr. Vice President and for for our group in what we're working. It's just to put the need inside the agenda. Was very impressive to watch, and we were grateful to convene with USNCI and the Harvard Global Surgery Program. And Benita, I don't know if you want to say some words, because some of the case studies there that we're going to be working on under the Women's Health and Empowerment Network, also with USNCI and CRDF, those case studies are amazing for getting access for end-to-end, women's cancer care. So I don't know if you wanted to say some comments.
Sure, yeah. My name's Benita. I'm a medical student actually, and I'm a researcher with the Harvard program in global surgery and social change. And we had the privilege of hosting this event just this week with all of these different case studies from different countries about the projects that they really wanted to see implemented. And I think, Carla has highlighted an incredibly important component, which is that if you want to implement change on a true granular level, you have to start at the district level. You have to start with the communities and really understand what they need. And these have to be projects and ideas and solutions that they want to implement on that level. So we work on surgical care, which is an incredibly complex, requires a lot of supply chain, requires a lot of infrastructure, requires clean water. Like, you have to have so many different structures in place to achieve surgical care. And that's incredibly, intricated with maternal health as well, right? But when we think about doing that, we have to make sure that those solutions are being implemented with an understanding of what the community actually needs, and not something that, we're coming in from our side without fully understanding what is happening on the ground. And similarly, top-down solutions from the political will, we have to make sure that these needs are understood and that they're coming from the people who actually have them.
No, thank you so much. And we really are grateful for the Harvard program on global surgery being a member of the Women's Health and Empowerment Network and working on these case studies. And hopefully you're going to work on the fund with us, as well as the roadmap. And now this, case study on supply chain, right, that we've identified as a strong issue. And I think, within our collective, brain power, I always use moments in time, because governments are investors, women philanthropists. They like to announce things, right? We talked about announceables, and Vinay and I are very familiar with the announceables we put together with UNAIDS over the years. But let's use that time frame, right? Gerhard, I think you said 2 weeks, right? We're going to get together again in 2 weeks, and I'll hold you to that. And I'll bring some of my women philanthropists and some of your colleagues. We've agreed to go forward. So I know we're going to use that. I do like to turn it over to Dr. Ted, because we do have to get practical. The companies are also on the ground, and if we have funds, we also need to deploy capital.
Sure, and I'd like to ask Jamie Nash from Genesis to comment on. We're grateful to him for staying up so late at night in Sydney, Australia. But Genesis is one of the largest companies providing radiation oncology care in the world. I think they're the largest single purchaser for both Varian and Elekta, and they've done a great job of public-private partnership. And we've been kind of brainstorming with them about how to improve access around the world to imaging and radiation oncology based on their example. So, Jamie.
Thanks, Ted, and thanks for inviting me along today. It is a little bit late here, but hopefully I'll still make sense to everyone. So as Ted mentioned, Genesis Care is the largest global provider of radiation oncology. We have over 250 clinics globally, predominantly across Australia, the US, Spain, and the UK. And we own and operate those clinics, and we work in partnerships with governments as well. And as Ted mentioned, we work very closely with all the suppliers in the radiation oncology world, obviously Varian and Elekta being the most prominent in that space. We have also looked at what work we can do in more LMIC markets, and we'd had a partnership and a pilot in Southeast Asia that we looked at over the last couple of years during COVID, which probably wasn't the best time to be trying to enter into a new market with some meaningful challenges from a travel perspective. But what we have been able to do is really looking at what technology can do to optimize the overall workflow and bring more access. And in our own clinics now, we've spent a lot of time developing our own software, because what we've seen is a lot of what the vendors have been producing in the space hasn't necessarily been designed for what the clinics are looking for from a provider perspective. And essentially, with radiotherapy being such a technology and physicians being an important part, but the physicians are really helped by a large technical team, there's huge potential to be able to actually automate a lot of the workflows and the technical work that happens as part of radiation oncology. And I think, as Serbi mentioned earlier on the call, is that we do have this technology solution now that we've been able to deploy across half our clinics globally, and we're looking to roll it out across all of them, where essentially it's an automated and AI-driven prescribing tool that links into the existing medical records provided by the variant electors of the world, but it allows our physicians to access evidence-based protocols and then drives the whole workflow. So now in our planning, over 50% of our plans are now fully automated, which means that doctors either don't approve or don't have to make any modifications for approval, or very minor modifications. So the potential here in some of the markets that we've been talking about is quite significant, because it potentially means that we're able to really look at ways in which we can optimize the workforces to be able to upskill people and then use technology more. And it's something that we found that when we were in the Philippines, it was definitely a challenge in terms of finding the right infrastructure in these markets and being able to deploy into it. And we've spent time now rethinking that, and as we deploy into other markets, we think there's real opportunities in it. And essentially also building a vendor agnostic approach, where we work with all of the existing vendors in the market and think about it more from a provider perspective. So I think the big challenge for us when we go forward with these now is actually really looking at the reimbursement structures in a lot of these markets. And that's one of the big challenges that we found, is that it's, radiation oncology is a capital intensive medical practice, but it's not just the capital, it's, the ongoing support of the department that is, ensuring that you've got the physicians and all the staff trained, and that there's actually a payer reimbursement structure that incentivizes the providers to be able to actually be profitable in the long term. And the challenge, I think, particularly in a number of these markets, is that often they can get money for funding the initial capital, but it's the ongoing running of the departments that can be very expensive. And it's the servicing the equipment, it's training the staff, it's paying the doctors, and in a lot of markets the reimbursement is very low, and it makes it very difficult for providers. And I think particularly a lot of private companies end up focusing on a very small part of the market where there's copay from wealthy patients who can afford it, and you end up with a very large tail end of the market where the government's left to support. And as a result, as Serbi mentioned, you get markets where there's either no access available or very limited access, because it's very difficult for these departments to be able to sustain a long-term investment, given that the capital requirements and investment cycle tends to be a 10 to 15 year investment cycle. So really, and thinking about what Gerhard said before around the challenge, I think, for private capital going into some of these markets is doing it on your own is difficult, and trying to find the right partners from a private and public perspective to be able to do it together to create long-term sustainable payer models where there is some level of support for funding around not just setting up programs, but sustaining them into the full investment cycle, to make sure that obviously staff are upskilled to the level that they need to be at, but then they're maintained at that, and more people are brought into the system to meet what will be an ongoing burden going forward.
Yeah, thank you, Jamie. And I think you raise a critical issue in terms of as we think about financing for technology, we also need to think about the financing at the individual patient level of how both the patient and their family and their society can afford the appropriate kind of high quality care, timely delivered. Marianne.
And that reimbursement issue is both lack of reimbursement as a barrier to accessing technology. It's also the timing of reimbursement. There is an opportunity in a number of these, a number of countries in which we work to actually shorten the time frame to reimbursement, which frees up domestic working capital. It's hugely important.
Yeah, and I think that was one of the things we saw in the Philippines, that it was the public reimbursement there, at one point we had blown out to 9 to 12 months. So for local providers, that becomes very difficult to manage from a capital perspective when you've got patients that you've seen and then you're not getting reimbursed for them until 9 months later.
Sorry, I have a question about research and innovation around radiation treatment. As molecular diagnostics are more and more available, for example, prostate-specific membrane antigen, it opens the door for not only identifying and imaging, i.e. the diagnostic component, but also therapies to be tagged, including radiation components. Is that part of the consideration as we think of how do we move this incredibly important technology that's very complex to run and deploy in lower resource, lower skill areas?
I think from radiopharm is going to be, and theranostics is going to be very, very important going forward, and it's something that GenesisCare we're leading and innovating on, but it's at the frontier at the moment, and it's obviously there's still a lot of investment going into it, and even in markets like Australia and the US, it's still not well widespread and well understood, and even the funding models in these markets are still developing. So it's probably not quite at the point where it'll be available in some of the markets that we're talking about, but definitely in the future. And it's it is going to be probably a big part in oncology care over the next 10 years. It's probably, unfortunately, going to filter through from the more mature markets into the more emerging markets during that time, I'd suspect.
Thank you very much. And I see some comments coming in through the live stream, and also some of you that need to leave as well. So we have a couple more speakers. I don't know. I see a comment, and
we should probably get. I know Gibby Dalawal is having some internet issues. So Gibby, I'd like you to comment if you would on kind of what you heard and your perspective as someone who's an expert in digital innovation. Gibby, can you hear us? No, it looks frozen. Yeah. No, he's talking.
Oh, I think you're frozen.
Or just.
Maybe while we figure out the technical issues, I wanted to turn over to NFTs and Gerhard, I see you raising your hand.
Joanne, I just want to say I have to leave. I have another commitment in 3 minutes, but I would encourage you to create a working group. I would gladly be part of that. Would gladly help you organize people who, again, as you said, not a talk shop, but people who can practically contribute. Both funders, investors, etc., as specialists. I'm very supportive of that, and I will help you in whatever way you need, Joanne. So thank you for that.
Great. So when we'll take you up on that offer? So I speak for Partners of When. And thank you so much for joining us and taking time as well. One of the mechanisms we haven't discussed is the NFT, and then we're going to take a little break because we still have other speakers that are going to join us at 10:30. So before we break, if you can quickly tell us about kind of the innovative financing mechanism that I know it's both beautiful, it's attracting different donors, it's a different type of, blended financing mechanism that is being used to redirect capital.
Thank you. And I'll keep it brief. I've actually written it all out so that I do. It's a pleasure to be here with you all this morning. My name is Zela Kadmasi, and I've been working in the field of international development for 2 decades, first in strengthening healthcare systems with the Clinton Foundation in Ethiopia, and then expanding the research arm of a WHO division on tropical disease research in Geneva, and then most recently as an advisor to the Ministry of Health in the Bahamas on HIV prevention with the PEPFAR program. But the most interesting assignment to date is the one that I'm here to share with you today, and it's my current role as a consultant to UNFPA's Innovation Unit. So UNFPA is the UN Sexual and Reproductive Health Agency, and we work in 150 countries, home to 80% of the world's population. Our mission is to deliver a world where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled. And under the leadership of our executive director, Dr. Natalia Kanem, about a year ago, we launched the UNFPA Innovation Unit that's now led by Dr. Nagina Muntin. And through innovation, what UNFPA has done is just disrupted inequalities to ensure that rights and choices for all and no one is left behind. And what we do is we take down the barriers to women and girls in obtaining services and exercising their right to sexual and reproductive health, right? So our aim is to achieve the 3 zeros: 0 unmet need for family planning, 0 preventable maternal deaths, and 0 harmful practices and gender-based violence. And we accelerate progress towards the Sustainable Development Goals by 2030. And what we recognize is that there's an urgent need to bring women to the forefront of innovation. One of the speakers earlier talked about how if we do invest in women, and I wrote it down for you, it's women invest in other women and then they innovate for other women. So we know that to be true. The UNFPA Equalizer Accelerator Fund, which is separate, is to equalize opportunities for women and girls through innovation. So we've launched this Equalizer Fund. It provides funding and financing options in UNFPA's mandate areas with a 3-stage approach, right? We invest in piloting new ideas, and then we test for impact, and then we transition the innovations to scale. And this enables evidence-based and accelerated positive impact through targeted investment. But for today, I'm here to share with you an exciting project. And while we're here talking about millions and millions of dollars that are needed within the healthcare sector, which we fundamentally believe, I'm here to share with you a project that actually requires very, very little money, but is at the intersection of UNFPA's kind of mandate, interest, artwork, innovation, and AI. So I hope you'll find it interesting. It's the first ever NFT collection under the theme Stronger Together, and it pays tribute to the infinite possibilities of a world of 8 billion people. So it's a body of work that's created exclusively to mark this milestone. It was created by an award-winning artist, and the artwork is here kind of developing. It was used with artificial intelligence algorithms, and it recognizes patterns in the thousands of images that are sourced from UNFPA's digital photo archive. And what I'll do is after the meeting, I'll ask if we can kind of share what these images look like. So we've had this artist create 800 pieces of work for us under the title Stronger Together. And it really is just an endless meditation in our shared humanity and pushing past the limitations of our collective imaginations. The profits for this will directly support UNFPA's work around the world with a specific focus on maternal health, family planning, and other women's health aspects, including reproductive cancers. And as we know, every 2 minutes, a woman dies from pregnancy-related complications, and every 2 minutes, women dies from cervical cancer. So the funds from this NFT at its floor price will support at least 1 safe childbirth, averting a death of a mother, or at least 2 cervical cancer screenings, enabling early detection and treatment. And really the focus here on why we're fundraising is because we need to. And because we're trying to climb a very steep mountain where the innovation space truly has not done a really good job of considering women. And when we consider women, then we empower women, and women tend to create innovations that help other women. And last year, as we know, innovations by women-led social enterprises reached 300,000 women in 21 countries. So we know that this investment in women will kind of yield other results. This is what we've been talking about all day today. But for this small effort of the NFT collection that we're going to display on the screen for you at the end, we're asking for a $30,000 donation, which at this point seems a bit laughable, but I want to share with you why. It's not that this body of work is particularly valuable at this stage, not yet. But it's the first, and it's the first effort of an innovation unit within the United Nations. And here we are trying to leverage NFTs as a way of fundraising so that we're not necessarily compromising the other ways in which we fundraise to do the other work that we do. But if we can prove that this is a model that works, then good for us and good for all of us in this room to be able to say that maybe we can be at the intersection of development and art and artificial intelligence and engage a new wave of, possibly interest, which at some point may come from NFT natives, younger people who may be interested in how do we engage them in these conversations is really kind of our thinking behind launching this NFT collection. So you'll see it's 800 images. They're beautiful. They change every time you pass them on to somebody else. So the idea here is if we were to sell one for $30,000, and not each one, but the entire collection by a single partner who says, I want to purchase, and they purchase the entire collection for $30,000. What that does is that allows you to keep passing on these NFTs to other people and keep the conversation going. If we can do that, then we've created some level of a model that says this is worthy of our investment, at the very least of our attention, and hopefully it's a channel for us to make impact. And if it's not, then here we are taking risks in innovation. We'll see what happens. So that's my intervention for today.
Thank you. I think we can look at the case studies for that as we're mobilizing, the different partners in fund roadmap. We have a case study on supply chain, and I would argue that the NFT would fall under the innovative financing because it doesn't seem like a lot of money. So I actually call on some of our women philanthropists to see what we can do here in terms of some of these case studies for fulfilling some of those needs quickly. I want to I see Robert that you just joined us, and we're going to take a little break, but we have someone that's been waiting and they're in a different time zone, so we can have them speak real quick, and then we're going to take a little break, and then we'll go to you, Robert, if you don't mind. But if we could have the person that's been waiting to speak, and then it's a tiny little break, so no one leave. And my online audience, please don't leave. There isn't an audience for everyone, to be clear. It's just a couple of our women philanthropists and investors that we have listening to this conversation to help us. But if the speaker online, over to you, Dr. Ted.
Yeah, Gibby, could you introduce yourself and respond a little bit to what you've heard this today? That would be great.
Absolutely. Thank you. I want to thank the Center for Global Health for this opportunity. It's so fantastic to hear the great appetite to solve women's health problems in Africa and emerging markets. Like most of you, I ended up hearing a lot about the issues in women's health in Africa. And I tried my best to ignore it for as long as I could. And then there was a mother who was in her early 30s and had a 1-year-old baby, and she was going to die. And that kind of changed my whole perspective on this, and I decided to get involved. This woman basically, like a lot of, I guess, since then I've heard, had cancer, came for treatment, but didn't get to the clinic. The clinic was basically not operational, and there's not a lot of funds for them to go back and forth from the clinic to the house, etc. So she was stranded at the hospital for a while. Eventually, she gave up, went back home, and then comes back about a couple of years later with a 1-year-old baby and a cancer that's not now treatable. And this basically happened again and again, where a lot of patients are getting lost, patient records are getting lost, and then these women end up in with villages and other things. So my background, I'm a CEO of One Business Consulting Group. We're basically a technology consulting company, and my view was, how do we solve this problem through technology innovation? We've made so innovations and so much progress. Why not bring to the setting in Botswana? So we started working with the Women's Cancer Clinic in and work with the team to develop a indigenous solution for the region. And I say the indigenous solution because these particular settings don't have the resources that we're accustomed to in the West. There's lack of internet, lack of smartphones. So what we wanted to do was connect the clinics, the doctors with the patients in a really seamless experience that would allow them to communicate, understand when their treatments are happening, where they need to go, and keep all the medical records in place so that they don't lost and go back and have to, do all those things again. And so, this has had a huge impact, in the women's health clinic. Every patient is enrolled. So that was the key, was to capture the patient at very first appointment, and then follow the entire trajectory of the treatment, and make sure that nobody is lost in the whole cycle. And if they are, they're identified, and some sort of connection is made with that particular patient. This also got rolled out to like 50,000 patients on HIV and TB monitoring program through PEPFAR in Botswana. And, now we're working on some machine learning models to answer certain other questions, because now there's so much data that's coming in. We have the opportunity to actually, leapfrog and start to other questions, as well as, scale up through rest of Southern Africa, and hopefully beyond that as well. So, this is directly impacting women's health, and obviously can go above and beyond that as well. And it's, something that's very much on the ground, impactful, and in the region. It's fantastic to see there's so much for this. I actually didn't realize that. So this I really appreciate the invite here, because it gives me a different perspective on what can be achieved with that kind of appetite in the background. So thank you for giving me this opportunity.
Thank you so much. We're just going to take a little bit of a break. And I know some of you need to go, but we have some other speakers from the investment side, and then also from our women philanthropists. Leslie, I look forward to seeing you in the UK. And as you heard, we have kind of that 2-week where we're going to be convening. So maybe we'll convene with you in person in London. When we're there, we'll have some of our investment community and women philanthropists who are based out of London there. So maybe that's a good opportunity. We'll touch base with you, and we'll look at these case studies for deployment. We're only going to take a 5-minute break. Robert, I see you on screen. So we're only taking 5 minutes, and we'll be right back.
Thank you very much.
Mine.
And through my
network of cancer centers in the US.
Okay, so we're going to get started because I know some of you online need to go. We've been having a very rich discussion for those of us that just joined us. And it's something where we've had a discussion around, the needs, especially in terms of that end-to-end care for women's health, some of those sustainable financing solutions, which was a topic, and what are the key outcomes. So we looked at a roadmap because we said, or hopefully we say the financing is there, but where's the technical assistance capital? Where's the private equity capital? Where is, some of that blended financing opportunities along with some of the data that's available? We've talked about a fund related to technology for women's health, specifically looking at areas of diagnostic, biometrics, nuclear science, supply chain management, and those case studies. So some case studies don't fit in within that fund, and using some of the infrastructure like PEPFAR, which is already on the ground, and a lot of our investors credit being in Africa due to PEPFAR, or else they wouldn't be on the continent. And then working through the Women's Health and Empowerment Network, which is co-hosted with USNCI. And now we are doing sessions on nuclear science and technology with CRDF. So with that really long overview, hopefully I gave it a good sort of overview. Ted and Ben, I don't know if you have any other things to add. Okay. I'd like to turn it over to Robert, who's both a philanthropist and investor. You joined us for our first one session on this. And, I know Conscious Capital is looking at different types of investment vehicles, and you wear two hats, both that philanthropic side, but also that capital side. And one of the things, Paul, you challenged us, and Paul is in the room, is that maybe we need to look at the different risk portfolios, right? For certain capital being activated, some capital is riskier, right, than others. Some capital, may need what we call a catalyst or first loss. Nobody likes to say the word loss. And then while we were on the break, we got a definition of a cart. And so because I've been too long now in the financing world, I just assume words like cart. So a technical assistance cart is really technical assistance money. So if you're doing investments into small to medium enterprises to do with women's health, some of these investments need a technical assistance cart. So the most familiar that I'm with it is that when we did the Girls Education for Fun, there were SMEs in women's education for lending for artificial intelligence that the private equity vehicle invested in, but we needed a technical assistance cart to help some of the other investments along or create a pathway. And I think what I'm hearing between supply chain is we also need technical assistance for the patient pathway and regulatory issues related to supply chain. And we're happy to work with, the partners around the room on it. That's really long because I was seeing on my phone that we have new women philanthropists that have joined us. So we will depend on your capital for that technical assistance capital, and also maybe just deploying vertically into some of the case studies you're hearing that can make quick impact. So Robert, I'm going to turn it over to you and to my women philanthropists and investors online. Thank you so much for staying with us, since I know some of you joined really early on at 7:15 in the morning. So Robert, over to you.
Thank you so much, Joanne, and happy Saturday, everyone. It's so wonderful to be joining this gathering, inspiring individuals using capital and as a way to create positive impact and improve the lives of many. And so I happen to be chair of a family foundation that was established 100 years ago by my great-great-grandfather. And participating in this family foundation really has changed my life, because while I had a background in finance for about 30 years, I began to recognize how philanthropy is necessary. And I'm going to speak about finance for a second, but in a way that maybe some of us haven't really talked about it in such a way. So the mission of the family foundation, when it was established 100 years ago, was to bring smiles and tender thoughts to the great in heart and high and low places, to comfort and cheer those who do exceptional things or suffer. Now, those aren't the kind of words that you typically hear when you talk about the movement of money and the creation of financial vehicles, but it can be a powerful tool to improve the lives of many. So so we've been making grants for about 100 years now, and to about 50 to 100 nonprofits a year. And many of these grants I would refer to in the investment language as seed stage grants, whereas Conscious Capital set up a public benefit corporation about 3 years ago. It was in 2017. We gained 501c3 status in 2018, and in 2020 we gained consultative status with the United Nations Economic and Social Council. At any rate, that public benefit corporation has provided what I would refer to in the investment language as scale donations or scale capital, much like we hear when we talk about like providing scale capital to companies raising their Series B and up rounds. And we've made these grants of about 16 million over the last 2 or 3 years to various nonprofit organizations globally, but namely those that improve the health of women, the safety of women, and women's education. Now, so I'm happy to speak about philanthropy off this call, and we can compare notes on some of the nonprofits that we're using and how we use blended finance to make these grants to various nonprofits or research, and how we might fund that. Then on the other side, as Joanne mentioned, on the investment side, Conscious Capital has been investing in companies that improve human health and planetary health and advance gender equality. And so again, capital being a way to improve the lives of many, and finance being the mechanism to do that. We look like a traditional asset management firm, both on the investment side and mirrored on the philanthropy side, actually. So we have various special interest funds, like thematic funds, that make these grants to research and nonprofits and institutions and so on. And then we do this on the investment side. So again, I'm happy to speak about our activities, but we are in the process. I'll name one that we're in the process of forming a fund, a gender lens investing fund. So not just funding female founders, but allocating capital in such a way that improves the lives of women and also achieves economic empowerment for women. So, Joanne, I'll pause and just if there's something you want me to speak about or any questions you have, but I'd like to, of course, introduce you to one of our potential portfolio companies.
Yeah, that would be great. I think probably, Robert, a commitment for, working on the technology for women's health funds, since you are deploying a gender lens fund, if you can work with that with us, using both of your hats. That's been most of the conversation earlier today.
Yes, we have a very unique structure that, for Conscious Capital. I mean, it's for-profit. We have for-profit funds. We have a public benefit corporation underneath that. There's a holding company. We have LLCs underneath that. So whenever we generate investment returns, the partners have agreed that 10% of the profits will be donated to nonprofits. So then we can actually push that, and we can make grants from the nonprofit, or we can push that down into a for-profit fund and then make investments through that. And then the profits go back into the nonprofit. It's just like, it sounds like complicated plumbing, but it's just a way to move the money towards whether it's from a for-profit or nonprofit. Ultimately, what we're looking for is to create impact as well as financial returns. So how do we do well by doing good? So anyway, I'm going to move on here to one of our potential portfolio companies that we're really excited about. It's a company that is based in Switzerland and in Lausanne, Switzerland, and it's called Pristem. And I'm going to hand it over to Lars. But why we're excited about this company is because there's a large population of people who do not have access to an X-ray machine, quite simply put. And so you have thousands of people walking around with tuberculosis who aren't even aware of it. So we identified a company that is solving this problem using Swiss technology and putting these X-ray machines in these locations that can serve many. So I'm going to hand it over to Lars before I give too much of your presentation away, Lars. So yeah, please introduce yourself and take it away. And it's nice to meet everyone virtually. I look forward to speaking with you after and happy to answer any questions you may have or chat.
Yes, hello everyone. Thank you very much for the introduction, Robert. So as Robert just mentioned, my name is Lars. I'm the CEO of Pristem. We're based in Switzerland. Actually, Pristem is one of 3 companies that our investment fund Prevest has invested in since 2018. We're mainly focused on digital health and diagnostics. And as we have a very hands-on approach, I also joined Pristem as their CEO last year. And maybe I have a few slides that I can share to explain what Pristem does. But as Robert just explained in the introduction, Pristem was really, or the mission of Pristem was to solve one of the major healthcare crises or major healthcare challenges in the world, which is access to medical imaging. And according to WHO, it affects around 2/3 of the world's population, over 5 billion people. And at the very origin of this project, it actually came out of one of the leading universities in Switzerland, the EPFL in Lausanne, and they had created an institute called Essential Tech, which was looking at solving these healthcare challenges for the primary care sector. And one of the first problems that they also have discussed with the WHO, who sits also in Geneva, was this solving this problem for medical imaging. And so maybe I'll just share a few slides and take you through what Pristem.
I don't think we have the ability to join do slides.
Okay, that's fine. Then I'll just do it like this. That's fine.
Oh, I guess we do.
Well done.
Can we share? Can you see the slides? Otherwise, I don't know if you can see this. Otherwise, I just explain it in a few words.
Oh, okay. I think you need to share them again, is what I'm told.
Okay. I can share. Okay. Right. Just a second.
And while you're doing that, Leslie, thank you so much for staying on, because I know you've been here since the beginning, and I really appreciate that. Really looking forward to working with you and seeing you in the UK.
Can we see the slides actually?
Yes, we can.
Okay, excellent. So, as I just said, Pristem was really the origin of Pristem was to develop a solution to address this major healthcare crisis, which is that the majority of the world population actually don't have access to medical imaging. And it was actually a big research project at the time with many different universities in Switzerland and also in Africa to look at what the major problems were. And one of the first major problems is that actually let's say the traditional OEMs like Siemens, GE, Philips, and their conventional X-ray technology was not adapted to and designed to solve or serve these underserved population markets. And then secondly, obviously there's, as we know, the global lack of radiologists that would actually need to provide the diagnosis. And then thirdly, if those services are available in many cases for a large part of the population, these services are actually not affordable. And at Pristem, we've developed an underlying, let's say, digital X-ray technology that provides actually the basis for a new type of business model in order to render this radiology service to the population. And the good news is actually you can address the majority of the needs in medical imaging, over 60% actually with simple X-ray. And a simple X-ray is used in diagnosing, as Robert just said, tuberculosis, so respiratory diseases in 60% of the cases. 25% of the application is used for trauma, like car accidents, spinal issues, and around 15% are used to diagnose cardiovascular diseases and cancers, like lung cancer. So it's actually very simple technology that can address a whole large range of diseases and covers a large need of the medical imaging. And we all know, as Robert just mentioned, if a healthcare system doesn't have access or sufficient access to such a solution, you have a disease like TB, which continues to spread. We know that around 1.7 billion people around the world have TB. Around 1.5 million people actually die every year. 10% of those are children. So with a simple X-ray, simple chest X-ray is one of the main tools to diagnose a disease like TB. And what we actually looked at during this research phase, where that just solving a technology problem itself is not enough. So we really said we need a full solution, a fully integrated solution, from providing first a very robust digital X-ray technology that creates the images. But we also need to have radiology centers close to those patients and populations that actually need them on a daily basis, and then connect this with a rather robust radiology cloud to connect all the main stakeholders, whether it's the patients, the referring GPs, the radiologists themselves. So Prism has solved the first technology issue, and we've basically built, designed, and patented kind of the Land Cruiser or Land Rover of radiology, if you will. It's a very high-tech technology that delivers high-quality images, but in any type of environment, in any type of context. And it was built in such a manner that it's robust, needs very little maintenance. You probably heard that, for example, in South Africa right now, they have load shedding and electricity supply issues of over almost half a day of no electricity. And this machine was exactly built for these type of circumstances of environments where you have a lack of stable electricity, it operates on batteries, and still delivers high quality images. It can deal with high temperature, dust. So any environmental constraint it was built to deal with. And then very importantly, we have put a lot of effort in thinking about the actual users, the radiographers who do use this technology on a daily basis, and made the interface how to use this machine very easy, intuitive, so that anybody, even non-experts like you and I, after 2-3 hours of training, can actually deliver and create a medical X-ray image. And then we said, very importantly, we need to get this to the population to make an impact. And the actually first center that we're opening, I'm going back to South Africa next week, is actually in Alexandra, to give you an example. It's just outside of Johannesburg. So just a few kilometers out of the economic center of Africa. And you have a peri-urban population of around over 1 million people who currently have no access to X-rays. They either have a choice to go to a public hospital, but then they wait for days or sometimes weeks or months. They may get an image, but they're not even getting a diagnostic report, so they can't get treatment. Or they have a choice to go into rather expensive private clinic. So we will open our first center. The idea is that we exploit actually and put our machines in that center. Patients can come in, pay 400 to 600 Rand, so around $20, $25 for an X-ray. Within 1 hour, they get a diagnostic report, which was actually provided by a radiologist, so they can get treatment again in the same day or the day after. So the idea is really that we exploit our technology and bring these close to the population into those small primary care radiology centers close to the population. And then obviously, as it's a fully digital.
I'm just going to stop you right there. Sorry about that, because we have some speakers that are waiting. But I think, one of the things that, we had discussed was looking at some of these case studies. So, hopefully if you can send us that information, we're going to share with the participants. I just want to give you just a minute. Anything else to conclude?
Yeah, so it's as Robert just said, it's we're building these centers now, starting in South Africa, and scaling those in the coming months and years, and growing this across not only from South Africa but in the SADC region, and then in Eastern Africa. So that's why we're working with Conscious Capital to find the financing for this project.
Thank you, Lars. Joanne, if I could just say that when Lars and the team are all personally invested in it, we're going to be pooling together. We're going to be part of a $15 million tranche. And then there's a second tranche of $15 million early next year. Conscious Capital will be taking a board seat. And so I'm happy to share why we like this opportunity if it's of interest to anyone, and also introduce one of our analysts that's covered the company and done his due diligence.
Oh, I forget to turn on my mic. I said we look forward to working with you under those multiple hats, including, X-rays. We did discuss that area of nuclear science and technology, the diagnostics related to it. And Robert, we will be recruiting you for working on that fund related to technology for women's health. One of the things that we touched on a little bit on the example of Ecuador, but really didn't go into detail, which is key to the success of either a fund that we're going to deploy with different types of capital. We talked, and I see Liz is back. Thanks, Liz, for joining us again. On the supply chain management perspective, is we need to get to the last mile. And that's where that cart, a technical assistance cart to a fund, would be necessary, because we do need that last mile in our work. And with that, I'd like to turn it over to Madres del Rio, which I think is a program where, I'm not encouraging NGOs to turn into small to medium enterprises, but sometimes NGOs need to turn into SMEs, and you see the growth. And I think, a lot of the success that you've had already, I know that you were presenting with Roger Glass earlier on some of this work. We need to get to the last mile, right? We have the funding. If we have this fund and we have the roadmap of where to go, we need organizations, like yourselves, and potentially maybe some of these NGOs scaling to SMEs. And I know you're already working with that with Grand Challenges Canada. One of the board members of Grand Challenges Canada talked earlier, Gerhard. So if you talk a little bit to that program, because I do practical, yes, is financing, practical is a roadmap of investment, but practical is who gets it to the last mile.
I am a physician from Cayetano Heredia Peruvian University, so I live in Peru, and I am associate professor there. And I did my MPH and my PhD in epidemiology at the University of Washington in Seattle, so I am an affiliate associate professor at the University of Washington also. And so I started my career doing infectious diseases in the Amazon, thanks to the Fogarty. I was a fellow at the NIH there. And after doing that, I became pregnant while working on the field. And I think it was then clear that I realized the huge gap in access to healthcare that pregnant women in indigenous, remote, and rural areas in the Amazon face. So basically, they live in extreme poverty. They don't have access to water, electricity, or sanitation. So that is a moment when I changed a little bit my career path as a researcher at Cayetano Heredia. And I decided to apply for funding to Grand Challenges Canada and the Peruvian Council of Science and Technology to build Mamás del Río, or Mothers of the River in English, which is a program that aims to improve maternal and newborn health in remote and rural areas in the Peruvian Amazon. And what we have done with funding from our GCC and Concitec has been to do formative research, implementing a robust intervention and evaluating the intervention. And what is Mamás del Río about? So in Mamás del Río, we train community health workers who are persons from the community, and we empower them with a tablet that has an application that allows them to do home visits to pregnant women and newborns, where they display educational content that have been created with the community. And also they gather health data that the government doesn't have, because 70% of our women deliver in their houses without any trained healthcare provider. So we also, besides training community health workers, we train traditional birth attendants, and we perform community sensitization and training of healthcare providers. So we have evaluated the program. We have several publications, the last one in The Lancet, when we show that this model, Mamás del Río, can improve almost all essential newborn care outcomes. So we are now, so thanks to the success of the program, this was funded. We received additional funding from the Inter-American Development Bank and the Ministry of Foreign Affairs of Peru and Colombia. And now our program is also in the border between both countries, operating in Colombia, who faces similar challenges in the Amazon. And what we're working now is toward including Mothers of the River into the national health policy in Peru as well as in Colombia. So that is where we are now. Of course, we have several challenges there, not only maternal and newborn health, but we have a huge rate of violence against women, lack of access to contraception, which is some of the work that we started like a low scale still. And also, of course, we need more cervical cancer prevention, which is a huge need. So there is no cervical cancer prevention at all. Vaccination is super low. So in Peru, we have free access to girls of 5th grade for the HPV vaccine for the quadrivalent, but it doesn't get to rural areas. So that is also a huge need that we have. And by the way, our program received an award, or several awards, but I think one of the most important ones was from the Pan American Health Organization. So we have an award for the Social Innovation Initiative Award. We have a video of the program, and I am happy to share it with you later if you want. It's with subtitles in English. So thank you.
Thank you so much. And I think these are some of the case studies that we also need to look at as we're looking at deployment. I want to turn it back to my colleague, Dr. Ted. I know that some of you had questions, but I'd like to turn it back to you, Dr.
Well, I wanted to make sure that kind of everybody at the table and everybody online was able to contribute. So I'd like to invite Devin Nagel to reflect on what you've heard and tell us a little bit about what you and your organization are up to.
Yeah, thank you, Dr. Ted. So my name is Devin Nagel, and I work with Build Health International. We're a design and construction nonprofit, and we develop healthcare infrastructure in low and middle income countries. One example of our work is we're working in partnership with the nonprofit Partners in Health to develop a maternal center of excellence in Sierra Leone. This will include a cervical cancer screening center, a birthing center, a NICU, ability for C-sections. And so I think I'm hearing a lot of overlap in a lot of what we're talking about today. But we're really focused on the architectural design and the construction and commissioning of health facilities and hospitals. And in our work in Sierra Leone, our construction is led by a woman-run construction team, which is also fairly unique in the construction world. But I just want to say, this as from a small NGO, I think implementing NGOs are not always plugged into conversations like this about sustainable financing. And I think the way that funds come together is kind of behind a cloud for us sometimes. And so it's really great to be able to hear and to be involved. And I think to that point, even having more voices like from our partners who are based in low and middle income countries will only kind of help advocate for what might be missing from these funds. And that's all I've got. So thank you for having me, and I really appreciate it.
Thank you so much. And something that I forgot to mention, a partner of ours, the Health Innovation Exchange, which we've been working closely with the Women's Health and Empowerment Network. They look at innovations to scale, and Pradeep is hosts that. And so for WHA, we're going to bring in some of the innovators to look at innovations to do with science and technology in the areas of nuclear science and technology as well. I know many of you also have examples of innovators. I know many of you know Pradeep, and so he's also a dear friend. Couldn't join us today because he's on vacation with his family. But I think in terms of the building the fund, the roadmap. But while we're building the fund, we have to continue to look at those new innovations, not only those existing, but those new technologies. And Ricardo, as you were saying, some of that AI that is being deployed. I just want to take a minute before we wrap up. Robert, we've been doing a lot on the financing. I'm also going to call back on Liz. And so I am going to push you to, join one of these working groups as you're thinking about it with both sets of capital, current capital, philanthropic capital. I don't know if you had other things to add, Robert.
No, we can keep it simple. Focusing investment and philanthropic capital on innovations that can improve and save people's lives. How does
Great.
that
And we're also looking forward to on the blended financing, because we're looking at a fund for women for science and technology related to women's health. So we'll also be there. Liz, I don't know if you had anything else to add on the supply chain side.
No, I'm just excited that the conversation is really focused around supply chain. It was our experience that was a very challenging component of access to medicines, particularly during the pandemic, and even after we still experience it. So happy to be a part of the group and the case studies.
You mentioned blended finance. I just wanted to point out, and maybe a lot of people know this already, but you look at an organization like U.S. Trade and Development Agency, and when you apply for feasibility funding, there's usually a co-funding requirement by the consortium that's applying. And it doesn't have to be dollar for dollar, but it has to be something. And so, teaming up with certain groups that are looking to do early stage work and being a source of capital, that if that, sometimes the groups that are providing the funding don't have the ability to come up with another $1 million or $2 million to support, $8 or $10 million of work, you can easily create a vehicle to come in and do that, to unleash the project. But again, to get that early stage funding is available. But a lot of these government entities, when they have these programs, are looking for some co-funding. We know in Canada, the United States, these government entities are there, but if you can't come up with a few dollars yourself, you run into a brick wall.
Yeah, and I think on that point, very valid. I think we worked with both USAID, the Canadian government, JICA. Also, I know a colleague had to drop off. The funding mechanisms activate, and it sometimes doesn't necessarily need to be hard cash, right? It's technical expertise where a private sector company, and even what we begin to do as partners, that's our also technical assistance, collaboration, our expertise around the table. Many times, not to call on Liz, but a lot of times, you can match those. And so we did work with Gilead on creating a primary healthcare insurance in Uganda, and those were matching mechanisms with USAID. So the mechanisms are out there. Again, it's not lack of capital, it's how we structure it and how we all work together to deploy it. So I think that's where I think as partners together, I challenge us. I also want to use some of UNAID's convening power. And Vinay, I'm going to take you up on that offer, because you can convene some of the local governments in Africa to work with us and really, deploy these type of solutions. Any comments there?
Sure, just quickly. We've mentioned cervical cancer several times today. I was looking on the Gavi website as to what numbers they've reached. I remember I think it was 2013 or 2014, they came up with an ambitious plan to reach 40 million young women with the HPV vaccine, and then there were supply issues, and then they had to reduce the target of 40 million down to 14 million. They haven't posted their latest numbers of covered, but the cost of the Merck vaccine is still too high. And I think a lot can be done both by combining, public-private partnership engagement with Merck, plus some really smart political pressure. And here I'm thinking about kind of the lead partner in the Go Further initiative, and perhaps a call from the Bush Institute or President Bush himself could help unlock this significant, if not price reductions, but making the HPV vaccine, the 2 doses, available not just at even lower prices, but perhaps even free, and really make it a concrete tool that we can move forward through the new fund that can link up to existing platforms that we're already working with through PEPFAR, through Global Fund, through UNAIDS, through MSH, through other partners that are already existing, and that can really scale up the numbers, and it'll provide a rallying call for something really concrete that's in our comfort zone, but we're still not reaching the numbers that we need to. And obviously we need to reach out to Gavi as well on this. They've recently announced new leadership, and so perhaps under the new leadership of Gavi, this could be an area of really short-term, very practical progress that we can make, because this is obviously continues to be a major priority for UNAIDS and for WHO and the UN system, not just vaccinating more young women and young men against HPV, but also really focusing at it from a vulnerability point of view, because it disproportionately affects young women living with HIV. Thanks.
Thank you, Vinay. So we have 5 months for UNGA announcements. I would suggest some of us can convene in a bigger group. Some of us convene bilaterally, looking at that fund for technology for women's health. We've gotten commitment. I know British Invest International. I accosted Colin as he was leaving, and he agreed if it's Africa focused. So I think we have a rallying kind of momentum here that we continue to work on this and the roadmap, because again, if we don't do them hand in hand, we don't know what priority countries to go to. And Susan, hopefully we can work with some of your data around that, and Ricardo, some of that mobilization from the policy and AI, artificial intelligence, and Michael, we've with the help of PEPFAR around the table. Dr. Ted and Ben, I'd like to turn it over to you for some closing thoughts, and I think if we went around the room one time before we closed as well, over to you.
Well, I'd just like to thank everybody for carving out time on a very busy week and a busy weekend for joining us. And I think we've made a lot of progress today, and think about next steps. Thank you.
2 comments from me. One is that the Sustained Dialogue, in our partnership with the US government and the UK government, wants to promote in diplomatic arenas the outcomes of a lot of these working groups, and a lot of your proposals and your ideas, whether they be systemic changes or small things that you could do with a bit of money. This is something we want to use our platform to advertise. The other comment, just the importance of what PRSTEM is doing, it really struck me, because the premise of the Sustained Dialogue is about tackling systemic development issues, and equipment maintenance always rose to the top. It's this basic infrastructure. We talked about stakeholder engagement and really long-term thinking about project management. How do you investigate the infrastructure, get the data, solve these systemic bureaucratic problems, and human capital? And here we go. Why don't we just invent a scanner that doesn't require that much upkeep and is more resilient? And so I think it features the importance of including technologists in a lot of your planning. Any project that's going to be longer than 2 years, got to be thinking about how AI is going to be integrated. So I'm sure PRSTEM is thinking about that too. How to use these data for broader health screenings. Talk with the company Cure AI, I think based in India, which is looking at TB screening with chest x-rays, but it's really good at finding early stage lung cancer and cardiac problems. And once we get the access to the data, you get these things that overturn problems that have plagued us for decades or even a century. So keeping your eye on the technology, and just because it's new, it doesn't mean, we need to weigh risks. And if development projects aren't succeeding the way we need them to, we can accept some risk in trying new technologies to overturn the apple cart. So I'm really excited about that. And thank everybody for this conversation.
Thank you so much. I'd just like to give a minute for each of the speakers, especially Leslie, you stuck with us since the beginning, and some of our women investors and philanthropists. I just really want to thank you because I've seen it online, and you've stuck with us as well. So we will be calling on you individually for either philanthropic capital from you, and you know that I call right away. So as soon as we've structured it, you'll be getting a call from me. And then you also have these wonderful case studies that you can, finance vertically. But Leslie, you and I haven't talked about this, but, I probably will be in the UK, for the wonderful conference you're hosting, and maybe we can get together some of these partners for, as Gerhard had challenged us earlier, in 2 weeks, looking at that fund for technology and women's health and the roadmap. So over to you, Leslie, for some closing comments.
Thank you, Joanne. And it's not been difficult at all to stay online all this time. It's been so inspiring to hear what's going on. And I mean, one thing just to close with is not forgetting to invest in women's education in terms of their empowerment, because, women are disproportionately unrepresented in leadership positions. And so investing in their education, both at kind of primary, secondary, but also tertiary level, is vital. And I won't go into it now, but I'm involved as a partner in a number of programs that are doing exactly that, and creating opportunities for women in low-income countries to access the kind of master's and postmasters level support they need to be able to really make a difference in their communities. So looking forward to seeing you in London, Joanne, and maybe next year when I do the summit, we can bring all these amazing people together into London to meet with their counterparts in sub-Saharan Africa.
Thank you. Liz? Oh, I don't think Liz?
Sorry, honestly, nothing more to add. Just this is good conversation. I hope we can make something happen for the many countries that need them.
Right. Robert and
just thanks so much, Joanne, for inviting me and Lars to participate in this gathering. And as I would like to learn more about the work that some of the people are doing in this room, and because what we can do is, we have investment analysts on the ground in Africa, in Europe, in the US. If we can understand, and we have the vehicles to be able to make investments or make grants, and as we understand what it could mean to work together to create greater impact, it becomes of great interest to us. So if we can see what it means to have governments and investors and philanthropists working together to move money to with the end result to save people's lives and improves people's lives, we're very interested. So we can activate, move quickly, and add a lot of value to the process. So there's going to be a bit of an education for us to understand what it could mean to work together. And that's why it'd be helpful to get to know each of you. So we'll put our name in the hat here.
Great.
Thanks
so we'll
for
call on
inviting me.
you within that one working group. Thank you, Robert. I'm just going to go
welcome.
around the table and then just close it off. So Michael, I'll start with you.
No, thanks. We're going to be launching off on what we call our sustainability roadmap process. This is going to shape quite literally billions of dollars of investments in systems and capabilities and social enterprises and working with ministries to take what they do spend now and make it more effective. So there's a lot of opportunity here to partner and think through how we shape what we are going to do naturally within the PEPFAR program to sort of maximize spillover benefits and other opportunities. Thanks.
Thanks, Michael. And we look forward to working with you and under the WEN platform. Marianne.
They say innovation comes from putting things together that aren't usually next to each other. And this particular collection of people represents so many different skills, so many different stakeholders, so many different perspectives. I don't think there's anything we can't do.
Thank you so much. And we will be calling on your resilience, because I know, having worked with you in the past, there are points where, again, it's not lack of capital, but it's really the resilience to get through the political hurdles. Sometimes it's the regulatory hurdles, but the political hurdles in structuring this, will take a little bit.
Sure. Thank you. Thank you for having UNFPA at the table. I think it's particularly important for us to be here as we think about how to put sexual and reproductive health rights at the forefront, using innovation and technology and artificial intelligence and all the things that we've discussed. Really looking forward to sending the NFTs around so everybody can take a look at the collection and get a sense for what it is that we're trying to do in terms of innovative financing and some artwork, some really great artwork for you all to take a look at. So thank you for having us here.
And thank you for having me as well. What we're all saying is women need access to education, to be safe in their homes and their communities, and to detect deadly diseases that we actually know how to treat early enough so they can be treated and cured. I would say we have to start with data to guide and be a roadmap. And we have to make this a political issue, not partisan, but political issue. And the ministries, it can't just be the Ministry of Health. We have to bring them all together. AI and technology, if we're thoughtful about this, we'll be able to facilitate care that's affordable and sustainable where there are scarce human resources and dollars. And then we come right back to the data. How do we measure the change? How do we demonstrate return on investment? So I'm optimistic. There are so many skill sets, as you've said. Thank you very much.
And we look forward to the roadmap.
Well, just I was complaining to myself that I'm staying an extra day in Washington. I could have gone home earlier, but today you guys made it worth it. So thank you for that. It was a very good coincidence to be in town before going back home this evening. I look forward to continuing to work with all of you. Thank you, Joanne, for bringing me on board. Looking forward to see how we can contribute to the work that this fund will certainly impact. Just 2 points on IDARE, the International Digital Health and Artificial Intelligence Collaborative. As I mentioned, the Canadian government gave the kickstart funding for the AI responsible, gender responsive AI platform on which other AI technologies can certify themselves to be ensure that they are AI responsive and have that gender lens. This is a project that has been kickstarted, but has the potential to accelerate much more. And I believe it is a very critical platform for the growth of all of the different solutions we're thinking in that space. This is something to be considered. And from the Unite Parliamentarians Network for Global Health, as I said, we're in 97 countries. Feel free to share my contacts if you're ever in a country where you need the parliamentarian support for global health initiatives. We're always here to help as much as we can.
Thank you.
Thanks for having me today. It's always a wonderful opportunity as a father of a 17 and an 18-year-old to come home and say what you did for a day, and your daughters actually pay attention and say, "Oh, that sounds pretty cool." So thank you for that. But going forward, happy to help as Cross River with everything we're doing. The one thing that I would add is we talked about public-private partnerships today and the need to bring governments along. And I think as we think about that, unfortunately, we also have to recognize that geopolitics matter. And when you think about mobilizing certain governments and how things have changed, not just in the last 14 months, but maybe in the last 5 years, when you start and you see the need for assistance all over the world, figuring out ways to reach out to, we'll call it the OECD countries, where, and I use that intentionally because that's where a lot of the money is that needs to be unlocked. But when we look at the geopolitics of it all, finding ways for those countries to cooperate in places like Africa, they need tangible things to do. And I think this is an opportunity to give them those tangible things as a building block for larger bilateral and multilateral relationships. But they need to start with something that is maybe not as complicated as some of the other areas they need to cooperate. And I think this can be a foundational point, things like women's health. Being very naive, who's going to say, well, no, women's health isn't important? It's easy. To reach the results we want, it takes a lot of work, but it's a good foundational point for cooperation and doing it in the context of larger geopolitical considerations to get certain countries into Africa to counter what other countries are doing in other levels. It's an unfortunate reality of the world today, but it also kind of presents an opportunity to get people's attention, to give them a very tangible thing to work on, to build larger bilateral relationships. So I just wanted to finish with that point. Thank you.
Yeah, completely in agreement. And both of you mentioned the Canadian government. The Canadian government actually gave the CGHD our first grant to educate people who were not in global health, and that brought on women investors and philanthropists. That's how I got to know Gerhard Paulus, who connected us over 10 years ago. And so it was also meant in terms of those geopolitical relationships. So capital does unite. And I think a topic such the one we're dealing with in this fund for technology for women's health and brings in HIV AIDS, it brings in women's cancers, AI, technology. And so there's a lot there. Over to you, Vinay.
Thanks, John. Paul, thanks for mentioning that you will share with pride your how you spent your morning with your teenage daughters. I also have two teenage daughters, 15 and 19, and they'll ask me, "Yeah, you spent an interesting morning, but it doesn't mean anything until you post it on TikTok." So, just very very practically, I think we've had a really excellent conversation and outlined some really practical next steps. And I think we need to hold each other accountable to really taking those next steps, and not just at some abstract point in the future, but as you've outlined, Joanne and others, in the next 2 to 4 weeks, convening around this, some really practical things that all of us can contribute to. And something I deliberately didn't mention in the meeting, but let's also keep in mind that the president of Uganda is thinking about signing off on some really egregious legislation that will ban the human rights of LGBTI persons in his country, and we've had several meetings on that. So any of you have connections or investments in Uganda, to think about flagging what you could do to leverage and raise red flags about the implications of this legislation being signed off by the president would be highly appreciated, because this is a major concern for the United Nations. Thanks.
Thank you so much. And before we conclude, I really have to thank my team that you don't hardly ever see. Sebastian is here. We have a huge team behind the scenes. I really want to thank Irene, who's based out of Nigeria. We have Francesca based out of Germany. The all IT team there, we have a big IT team also behind the scenes. Thank you, Alan, Aze. And so really thank you to everyone. And thank you also I know all of you, your time is precious, so we will not waste it. And with the help of USNCI and CRDF, I think we're looking forward to, the next sessions, the next working groups. We will convene in 2 weeks. If you know me, I say 2 weeks, we'll get a group of you together to really nail down what this fund for technology for women's health looks like. What's the technical assistance? Who can give some philanthropic first loss capital? And who are maybe some of the private equity funds that can deploy it. So, and then also the roadmap. I do want to stick in the roadmap, because we've created funds before, and the greatest mistake we made when we created these funds was that we didn't know the priority countries, and we didn't know the proper funding mechanisms. So some funds that were created with donor government funding went to an identity that took 40% overhead. So as we're doing these mechanisms, let's look at things that are taking 2 to 3% overhead, not 40%, and how we find the data to really make sure we're doing the implementation. Thank you so much. Thank you to everyone. Thank you. Thank you to our co-hosts. And thank you to those online. Goodbye.
Thank you.